We'll call this meeting of the MNsure Oversight Committee to order. Thank you, by the way, to my colleagues on behalf of Representative Mack and I for letting us appear by phone. Last time, it's much better to be here live and in person and upright. The last time, I think the last time I was flat on my back and just torn my Achilles and had surgery, and anytime I would put it beneath my heart, it would start to throb. So this is the throbbing pain I had in my foot was not as a result of anything any of you said. First item that we have is the approval of minutes from the July 22nd meeting. Senator Sharon will move those minutes. All in favor say aye.
Aye.
Any opposed? Seeing none, those motion carries. Next is item 4, the update from MNsure's board chair, Mr. Beutner. Welcome.
Thank you. Hope I don't need these, but one never knows. Yeah, I'll try and work without them. Thank you, everyone. I appreciate the time on the agenda to provide an update from the last time you met in July. On behalf of the board, I can say we're pleased to be able to serve the state and the mission of MNsure to ensure that every Minnesota resident and small business, regardless of health status, can easily find, choose, and purchase a health insurance product that they value and does not consume a disproportionate share of their income. And in fact, we saw that last Friday with the announcement of the lowest rates for an exchange in America. It's a great place to start, and we have a lot more to work on before the doors open in 21 days. But just wanted to give you a little reminder of sort of where we are as a board. We're a small board with very diverse experience and knowledge in the healthcare arena. I like to say that we have a pretty good knowledge of the 3 Ps of healthcare: providers, payers, and patients. Payers including, obviously, insurers and employers, as well as consumers who pay for a portion of their care. But since our appointment as a board last May, we've met over 10 times over the summer. It's not how I expected my essay of how I spent my summer vacation to go. Better? All right. But, I know each member, as well as myself, has spent numerous hours talking to folks who've raised questions about what does this mean, meeting with dozens of organizations. I mean, to the point that I would say as a board, we've spent hundreds of hours over this summer getting ready, and MNsure hasn't even started yet. April can take you through and cover certainly a lot of the milestones since the last time this body met: the call center opening, the awareness campaigns, thousands of consumer interactions at the state fair, not to mention all the operational readiness reviews that make us confident that this public exchange will be ready when the virtual doors open in 21 days. But at the last MNsure board meeting, we actually had the official transfer of authority from Commissioner Showalter at MMB. If you recall, the MNsure enabling legislation established this board appointed by the governor to provide leadership for MNsure. And the board has broad authority and responsibility: budgetary, operational, hiring and firing powers. But in order to accept that authority, the legislation also required us to establish the appropriate governance procedures and policies so that we could exercise that authority with the appropriate level of oversight. So back in May, we set out on a journey to build that, and we had a lot to do. That's why we met every other week all summer to not only understand what we wanted to set up as good governance framework, but also understand the operations of MNsure. The staff has been working hard to create the most appropriate mechanisms to fulfill our obligations. So we spent the summer examining and adopting probably a dozen published documents that establish clear and transparent governance framework, including charters, bylaws, code of ethics and business conduct, advisory committees, as well as a policy on when and how we may create future advisory committees, as well as charters for the Health Industry Advisory Committee, the Consumer and Small Employer Advisory Committee. We talked about delegation of authority. We talked about fiscal policy, tribal consultation policies, conflict of interest, and not least or last, but reporting and measurement, both for MNsure as an organization and for us as a board. To effectively carry out our mission, we need to understand what it is that we need to accomplish and hold ourselves accountable. But in addition to these formal documents, the entire set of documents, and I think they've been provided to you, as well as our conduct at and in between board meetings, is really what will establish an open, collaborative spirit to fulfill the mission of MNsure as we've stated in our charter and bylaws. So now we've gotten that formal documentation required, sort of check the box and say, yes, they exist. How do we make them live and breathe? We can take on the mantle of authority. And to be honest, we appreciate the legislature's foresight in requiring very detailed governance policies, procedures, as well as things like the advisory committees, which now that we have the authority to do so, we're in the process of filling those seats so that we can get the input that will help us govern most effectively. But the next step for us is to operationalize those documents. And in any organization, it's the practice, not the words, that really matter the most. And you know, for me to breathe life into a little bit, let me give you a couple ideas of some of the things that we've already seen, some examples. Things like conflicts. You know, MNsure is a new and unique beast, and it will create not only potential for conflicts, but appearances of conflicts. And as the new marketplace develops, we're going to find out more information. Additionally, you know, by our nature as a public board, we have the potential for conflicts, especially when we want to have citizens on the board who have knowledge of the subject matter that we're responsible for. So that's why when we adopted our conflicts of interest policy, we went beyond what was in the statute, beyond what was in the enabling statute, and requires essentially a continual assessment by board members of their situation as the situation will change. You know, for us, it's important for a board member to be mindful of what they do in their day job and how that impacts decisions on the MNsure board. And so the guidance in the policy reflects our desire for it to be conflicts, as an example, to be a continual process, not just a one-time thing. And so as board members' personal life situation change, as the impact of MNsure on the marketplace becomes known and real, the policy will really come true to life. But we've set out a good framework, we think, to guide the board as we move forward. Another example is things like public comments. I mean, as a board, I've talked, I think, with almost every member on the board, how important it is to get public engagement and get that input into us. And, you know, we start every meeting with a reminder of our mission. We start every meeting with a story of a consumer who's going to be affected by what we're doing. And now, tomorrow, when we hold our first meeting with a board with real power and authority, it's one of our first items on the agenda is how best to continue to get public input in a meaningful manner that enables us to act upon it. So we'll be talking about creating mechanisms for our 7 members to get the best actionable information. Maybe it's an open forum on every agenda, but even if we do that, it's things like, should it be limited by time or by topic or by number of people? Should there be a requirement for public discussion at our meeting to run first through our advisory committees? There's ways for 24/7 input if you can't make it to the meeting, whether it's by email or phone, and have that coordinated through MNsure staff. And so those are the types of things that we're going to be talking about tomorrow at our meeting. There's, you know, innumerable ways to gather input beyond the advisory committees that we're establishing. And so one of our first priorities as an active board tomorrow will be to start discussing that. And I look forward to the next meeting of this group to be able to report upon the effectiveness of how our open meetings are working, how are we getting that information. One other issue that I want to address that reflects on how we operate on the board is the recent public discussion of the outreach grants. Outreach grants are just one element of MNsure's efforts to engage communities and to help consumers navigate a new and simplified marketplace. Although it's still obviously a very complex marketplace, the world of health insurance is not simple, and we recognize that. You know, there's $11 million of enrollment funding to pay for outcomes. As people are enrolled in MNsure, there is going to be money paid to those who help them get enrolled. We have 300 groups who've stepped up to become assisters, trained by MNsure to help their communities. We have 1,800 brokers who have a strong interest, heck, it's their job, they're going to get paid, to help consumers come through that. In addition, we announced designees for 30 outreach grants to supplement this work. When MNsure staff was writing its grant application to fund all of our outreach efforts, one of the feedbacks that the staff got from the community was we needed some, not just the enrollment funding when somebody signs up, but they needed some money to jumpstart. There are organizations in the community that can be really effective in reaching out to unreached populations who may not have the infrastructure. Do they need, you know, literally simple things like, do they need tablets to be able to bring into the community to help people get on to MNsure? We had over 100 applicants asking for $20 million. The willingness to help is fantastic. The need in the communities is obviously great. I wish we had $20 million to give away to every applicant. So what the staff did is published requirements and said, this is what we're looking for. I've heard feedback, obviously, that, we may not have done as good a job as we could. So we put it on our agenda tomorrow to do exactly this, to discuss the gaps, to identify how the board wants to provide direction to staff to identify those, to address those gaps. And now that we have the authority, we can really act. We've asked staff to see if it's possible to reallocate federal funds from existing grants to immediately free up additional funding to add to the grants that have already been designated. We have a process in place. The 30 designees are still going through the last part of that process, background checks, providing additional detail. Some of those may drop off and add funds back into the pool. We're going to find some more money through reallocation and use the process to help identify and cover as many gaps as possible. I'm sure at the end of this, we'll still have gaps. I mean, we're not going to find $20 million to address every request, but we are stewards of funds. Right now it's federal funds. Soon it will be state funds as we're up and running. But we're highly focused on executing and serving the mission of MNsure, of ensuring coverage for all those who choose to find coverage. The outreach grants are one small way to help achieve this overall goal. And the goal will take time. It's not going to happen overnight. The first people out to outreach aren't going to hit 100% of the populations we're trying to serve. But we're trying to get there, and I'm pleased with the progress we've seen so far. One final comment before we get drowned in the minutiae of the details that make up the day-to-day progress and success that April and the staff have been working on. I've been amazed and pleasantly surprised at the support that we've received across Minnesota in what we're building. We're creating something unique. Minnesota, on top of it all, is unique in this country. We are the only state where we have the stated support of all the stakeholders that are necessary to make this work, starting with the legislature, obviously the executive branch, the administrative agencies, Commerce, Health, DHS, and other agencies have been active participants and helpful in what we're doing. The carriers, the providers, looking to be in the networks. I mean, the announcement last week of the lowest rates in the country for public exchanges doesn't come in a vacuum. It's the carriers participating. It's the providers willing to be in the carriers' networks. And not to mention what's obvious for all of us is the hundreds of community organizations that have signed up to do outreach. Most, we've got 30 outreach grants that are going to help supplement what we're doing, but most of them are doing it to fulfill their own mission. Because what MNsure is doing is helping serve their mission for their populations. That cooperation and collaboration has already started to deliver real results for Minnesota. The lowest premium rates in the country, added to the fact the substantial tax credits that will drive those rates for individuals, given their personal situation, even lower. And I expect that we will continue to see that broad community support when the virtual doors open in 21 days. I just want to thank all of you on this committee for your willingness to serve on this committee and help devote your time to making sure that this does succeed. Thank you very much. Appreciate your time.
And thank you, Chairman Beutner. At this, did we want to hear also from Ms. Todd-Malmlov, or is she just here to answer questions that people may have?
Probably a good idea. She's got lots more detail.
Well, and primarily I want to give members an opportunity to ask questions and raise what concerns they may have, but I just want to make certain that we all sort of have a base of information to work off of. If you'll just identify yourself, I think everybody on the commission knows who you are, but it'd be nice to, for the record.
Mr. Chair, for the record, my name is April Todd-Malmlov, the Executive Director of MNsure.
Okay. Any particular comments that you have for us, or are you just able to answer questions or concerns? I have one question that I wanted to ask at the outset, and that is, obviously, I think we all want to make sure that the outreach grants are as comprehensive and reach as many communities as we possibly can. And I just wanted my takeaway from your comments, Mr. Chairman, were that that process has not been finalized yet, and you probably for us to ask you to guess what may happen at tomorrow's board meeting, but it sounded like you were sort of foreshadowing that it's still in the works. Can you?
Yeah, I guess the best way I describe it, there's really two parts that are still in the works. The original designees certainly need to fulfill the requirements of background checks and some additional information the staff's working for to finalize those grants. Additionally, we have asked, as a board, have asked the staff to see if it's possible to reallocate funds and find additional funds to essentially provide a second set of outreach grants. Like I said, it's not. I can't imagine it's going to be $20 million. I anxiously await to see what we can come up with tomorrow to talk through, what we can do to supplement what's already been awarded.
Okay, and then just one other quick, you commented about the rates being the lowest in the country compared to other MNsure type organizations. How many states now are there for either one of you that have gone through the process and are aware it? And are they just the smallest states? Are they representative of large states? Either one of you know the
Do you know
details?
the detail? I think it's 14 states.
Mr. Chair, I think there are 14 states that have released their rates, and it's really a range of sizes, ranging all the way from California and New York on the large end to some of the smaller states on more similar in size to us and smaller states as well.
Okay, and Minnesota had the lowest rates compared to all of those that have made it this far in the process this far?
Yes, Mr. Chair, we have the lowest rates, and I think even the Kaiser Family Foundation has put out a comparison of all the states that are there, and it very clearly notes Minnesota as the lowest one of all those states.
No offense to our friends in the Department of Commerce who concluded the same thing, but it's nice to have it be an outside entity as well in the Kaiser Family Foundation. So, and now I'll just open it up to questions from members. We've got Representative Mack already on the list. Representative Mack.
Thank you, Mr. Chair. And just it's a follow-up to your question about the Navigator and Outreach Program, and just to something that was said about the finalization of the grantees and things of that nature. I know the 30 were announced, and I know there's been some questions and concerns raised since that point from various folks in the community. I guess part of my question, you said that part of that finalization involves background checks being finalized and things of that nature. I guess my question is, were background checks not finalized beforehand, and if not, why not before those were announced? Couldn't you have saved maybe a few headaches if that were the case?
Ms. Todd-Malmlov.
Mr. Chair, Representative Mack, I think you have a copy of our MNsure, our grant, our RFP for that grant announcement. And the process that we had for the grants really came in 3 phases. One was an initial review by our staff to make sure that the application was complete, that people met the eligibility requirements. The second component of the process was a review essentially of merit of the application. So what was the strength of the application in terms of what the funds would be used for, and what populations they were intending to serve, and what was the geographic breadth of that. And within that evaluation, we wanted to make sure that there was balance geographically, and also amongst those populations most needing the funds, so those that have disparate health outcomes, to make sure that those were targeted to that. And then as a third part of our process, what we told the grantees was that based on that, we would do an initial announcement of those grantees, and the final part of that process was the finalization of contracts. And we told the grantees that some of what they had requested in the dollar amounts may not be what they actually get based on the negotiations that we have, and also would include, as part of the contracting process, background checks, would also include making attestations and information that would be checked on our end to make sure that they could comply with all the federal requirements that we have related, for example, to use of funds. So what is an appropriate use of funds or not, making sure that there was, for example, no use of funds used for lobbying. Those types of things are being checked right now through the contracting process. And so once that is completed, we will have those contracts in place. Once those contracts are completed, the detail of all of the applications will be available to the public.
Representative Mack.
Thank you, Mr. Chair. And I'm not familiar. Once these outreach navigators or grantees are granted the money, I'm just trying to remember, is this an ongoing, into the future? Obviously, the role of navigators is going to be ongoing, but these grants, are they going to be reallocated on a certain basis or on at a certain regularity, or how does that work? And I guess I'm asking for the people that didn't get it this time. Can they adjust going into the future and say, we're going to go for it next time and hopefully get chosen, or how does that work?
Mr. Chair, Representative Mack. For the grants for this year, they will cover 1 year. So they go September of 2013 to September of 2014. We have also requested an additional $4 million in the grant request that we just made to the federal government on August 15th for $4 million for next year. After that, it would be up to the board to on the budget approval to determine whether or not grant funding would be an expense that would be funded through our budget.
Okay. Thank you, Mr. Chair.
You bet. Senator Benson.
Thank you, Mr. Chair, and to either Mr. Beutner or Ms. Todd-Malmlov. There are 3 grantees that have been raised as being particularly problematic. Bruce Lyon Dugan, his agency, and if I mispronounce his name, apologies in advance, Small Business Minnesota and Health Access Minnesota. Specifically, you talked about in the RFP that you considered balance of geography and underserved communities. Could you please describe how they're providing balance, since they're all metro, and which underserved communities they'll be serving, since they don't have a track record of working with underserved communities? How can you shove everyone else aside and give them money? Do you have a track record that you'd like to tell us about now? Because one of the organizations came into existence 4 days before the RFP was due. And so if you didn't use geography and you didn't use communities in need, you're going to have to be really clear what the criteria was.
And just noting, we've got a whole section on this particular topic, Senator. I still want the question answered. I'm just saying if you could perhaps be brief at this point, Ms. Todd-Malmlov, and then we'll come back to it when we're at that point on the agenda.
Yes, Mr. Chair and Senator Benson, I'll try to answer this briefly, but we'll talk about this in more depth on the agenda as well. The particular applicants, we are not able to share the details of that application, of those applications at this time, because we're still working through the contracts to finalize those contracts. One of the things I would mention related to the applicants generally, of the 30 that is there, is that we did encourage coalitions to come in and serve as applicants. And those coalitions, even though they may be new, do include multiple organizations within those that have a broad expertise throughout the state and with multiple populations. And the reason we encourage that is we wanted to encourage the most cost-effective use of funds and the most collaborative work that we could with those collaborative entities. And so I can talk about that a bit further as well in terms of the detail of what that means, but did just want to highlight that as a point as well.
And
Senator
so,
Benson.
Mr. Chair, Ms. Malmov, what I'm hearing is let's create another layer of nonprofits that other groups can work under instead of just using existing entities who already know what they're doing. It's not making a lot of sense to me. And, I saw pictures of Paul Bunyan getting on water skis. That's great, but we have some really serious stuff we need to figure out here.
Ms. Todd-Malmlov.
Mr. Chair and Senator Benson, part of the reason actually for the collaborative efforts that we encouraged through the grant application was based on feedback from community organizations all across the state. Given that we have existing organizations within the state that have expertise working with particular populations or on specific health issues or in particular areas, with MNsure coming in, it's a brand new entity that is actually bringing forth the need for expertise from a variety of areas, including, for example, those that are familiar with public programs, those that are familiar with private coverage, those that may be familiar with how the tax filing system works. And so some of the feedback that we got from multiple organizations across the state was we're going to need to create collaborative entities so that we can best serve these populations in the most cost-effective way. And so our intent was to be responsive to those comments that we had received from the public.
And we had a tie, I think, in terms of Senator Hayden and Representative Loeffler. Hands went up at the same time. Either one of you.
I'll defer to the House.
Well, thank you,
Representative
Mr.
Loeffler.
Chair and Senator Hayden. I know we have another agenda item, so we can talk more detail about the grant selection there and the concerns that have been brought to me. But there was kind of a broader policy issue that kind of dovetails on an issue that the chairman brought up that has been raised to me, which is the issue of conflict of interest even within these contracts, because one of the responsibilities that you've outlined is enrollment in qualified health plans. And since you have selected entities that are health providers, in addition to other roles potentially in the community, and and there's a reference in the RFP to disclosing, to complying with Minnesota rules regarding to conflict of interest, which I don't know if that's related to their employees or it's in the conduct of their business, but there's some concern that some entities that are providers may not be as good at reaching out to, or may use this as an opportunity to reach out to increase their patient base or steer people to particular plans based on networks, those sorts of things. And I just didn't see that really addressed in the materials that you gave us related to the RFP. And I'm wondering, as you're preparing contracts, or if the board's policy on the broader issue addresses this, because that is a concern that's being raised by some.
Yep. And I know, just if I can add to that, I actually wanted to see some of the applications, so you could see what they said in their own words. But apparently we're still at the point in the process where they haven't been finalized yet, so they can't release publicly what they said in their applications. But I assume those applications become public as well once the finalization. But to that question,
Mr. Chair, my
yes,
concern is
Representative
more
Hoffman.
about the contract and the expectations of those who are selected. What are they expected to do to overcome that, or have an obligation to, can carry out all their business in a way that's seen as fair, even by people who might select other providers or other networks or whatever.
Mr. Beutner.
Absolutely, Representative Loeffler, Chairman Atkins. That's the whole point of going through the contracting process, is to make sure that we have a contract in place with them that helps them recognize their obligations as grantees within the framework of our conflict rules as well as state conflict rules as well. So that's exactly what's going on now, is to make sure that that gets vetted individually with each grantee to make sure that we don't run into those conflicts and try and nip it before it becomes an issue. Obviously providers is a perfect example of, in this new world, there are inherent conflicts. However, providers are probably our first and best line of communication with patients who don't have coverage out there, because when they go in to see a provider wants to get paid, but patient's not going to come back for follow-up visits and aftercare and the appropriate care if they don't know how they can pay for that. And so, they're probably the most trusted resource that a consumer is going to have outside of their own individual communities. So I wouldn't want to ignore providers that serve communities in need.
Mr. Chairman, my goal in this program is to go far beyond that historic connection to actually getting people to sign up in advance of a health problem and getting preventive care. The research is really clear that people do not take advantage of preventative care, of early diagnostics tests when they don't have coverage, so they're not going to end up building that kind of relationship. And so I think that I would really look to this as a more upstream sort of program. And I do think that the issue of how the experience of the applicants in relating to a particular community was evaluated is a concern. I can just tell from looking at the list that some groups are selected that have less visibility in communities I help serve and represent than others, and I'm not sure. I hope it wasn't a reward for good grant writing, which is always difficult to avoid.
Thank you. Senator Hayden.
Yeah, well, thank you, Mr. Chair, and I know we're going to kind of dig into this a little bit, but so I'll reserve some of the questions and maybe comments and criticisms that I think some of you know that I have about the process until then. But I do have a question maybe that's a little broader, Mr. Chair, to Chair Beutner, Mr. Todd-Malmlov. There was some reference to tomorrow, or we're kind of looking to see if there are other dollars that could be available, if there might be, maybe some of the folks here don't get contracted and that goes back in the pool. Maybe there are other dollars that haven't been spent. I won't go into the ad campaign, but it is, I've heard a lot about it in the communities that I serve, and so maybe there's some savings there. But I guess the question is, how do we, if the process got us to the point where there are a lot of people who feel like, say specifically in the African and African American community, that has high rates of uninsured folks, but there doesn't seem to be organizations, African American, kind of those that that have been here in our newer African American constituents that are here, if there wasn't a targeted way in which to bring those organizations in so that they can go back out and then talk to those folks who we know are uninsured. How do we know that then the next iteration, if there is new money, that we don't do the same thing and just add more money to the folks that we have, or find other organizations and give it to them? I'm not sure that finding more money, though I want us to expand the pool, but without a change in the way that we look at applicants, if we indeed see this as an oversight in the African and African American community, how do we know that we just don't run into the same thing?
I think they said before you got here they were just going to ask you who to give it to.
Yeah, well, Mr. Chair, I'd be glad to do that. That's not a problem at all, but that's what our process is. We can't adopt the Hayden process if that's what you
You got it.
Chair Beutner, that might not exactly be the process you have in mind, but
Depends on how deep his pockets are. Senator Hayden, Chairman Atkins, I agree with you. I think that's part of what the board discussion is about tomorrow, is to help provide direction. Part of, as Chairman Atkins referred to, these filings are still not public information, so we can't go into the detail of saying this organization, who may not be familiar to the communities at large because they may be new or have put together specific programs to address specific communities. I think part of the direction and the discussion that we as a board will provide staff tomorrow is looking at and saying, in addition to the grant itself, and, as you say, Representative Loeffler, we don't want to just reward good grant making, good grant writing, is how are those grantees viewed within the community at large? I mean, this is because it's such a small bucket for the need, $4 million versus 20 that was self-identified, and there's probably, hundreds of millions you could spend to reach people. I think the symbolic effort of what organizations have community stature should be something that, as we find more money and look to do more grants, should be taken into account and may not be formally part of the RFP process. And that's more of a judgment call and some of the input that we've gotten from you and others that I think the board will give staff direction in making sure that these grants are visible within the communities they serve as well.
So, Mr. Chair, just to follow up on a broader sense, and then once again we can dig a little deeper. If I may, Mr. Beutner or Mr. Todd-Malmlov, how many African or African Americans are involved in the process of looking at the grants to help make the award?
Ms. Todd-Malmlov?
So Mr. Chair and Senator Hayden, so the process to look through the grant applications was made by staff both at MNsure and a staff from DHS involved in their MNCA program, and it includes our staff that are working on the Navigator Assister program.
And Senator, if I can just interject one, how diverse is I haven't wandered around at MNsure to see what your staff composition is, but how diverse is the staff at MNsure itself?
I don't have the exact statistics with me, but just based on what I know of state agencies, I would say that we have probably the most diverse workforce of any of the state agencies.
And I'm sorry, I just, before, my mind, things
Yeah, well, I know
escape my ears.
that happens sometimes in the House, Mr. Chair, but I did have a specific question, so you didn't answer my question. So what I'm trying to figure out is those folks that were making the decisions to issue the grants, how many of those people were African or African American?
Mr. Chair and
Ms.
Senator Hayden, we don't have anyone of African American heritage in our Navigator Assister unit in our program.
Okay, thank you, Ms. Chair. That's the question I wanted to answer, and we can.
Got it. Anybody else? Senator Sharon?
This is an agenda item, right, that we'll be coming back to, so I probably could. But I just want to be clear that what we're talking about right now, at least at a 50,000-foot level, is the grant applications and their distribution, which is providing support for the development of the infrastructure needed to do the in-person assister elements of this program. But that my understanding is that there'll be many more systems out there that do not get this money that will also be providing this. This is simply related to some money that would be used to help people get up and do outreach and assist people to get into health care coverage. So I was wondering, and we can talk more about this later if you want to, if the problem that reaching these very special populations that are difficult to get engaged in this program, if we haven't been able to get them engaged before using the systems that are in place now, and that we may need to go to some that do not have these histories that of performance. We may have to get outside of that and allow, and I would think grants for organizations that can't get up and running is partly because they don't have the resources to get where they need to go to help people. Whereas some of these other sustained organizations, been around for a long time, have systems in place already. So my concern is that we go back to the same well that has achieved the same outcomes that are good. I don't want to dismiss the outcomes that they've had, but they don't get at these special populations that need that we need to touch and to help communicate in their culture, in their language, in their methodology to get where they need to get coverage. So I think I share what Senator Hayden is concerned about, our methodology for selecting grant recipients.
I don't know that that was necessarily a question, but I think by the nods, it's been acknowledged. So, Senator Benson?
And Mr. Chair, to Senator Sharon's point, that's why I asked what specific communities these most troublesome people were looking at serving and how they contributed to geographic diversity. You, as a Greater Minnesota Senator, know that that is a continual concern, and we did not get a response. We had general niceties that we can't disclose anything, but it needs to be very clear to the board and MNsure that Senator Sharon's right. We might need to target a specific community, but then that had better be part of the reason that they get the money. And there better be measured outcomes, because this is money. This isn't laying around. This is earned and transferred to the state and given to these organizations. And the appearance of impropriety is enough to raise a lot of heat, and we'd like some light.
If I might, I mean, the message is probably coming through loud and clear. Maybe and today, the day before your next board meeting, may not have been the most opportune day. We set this, obviously, a few weeks ago. But it's also, I mean, it's kind of nice to be the day before. I think the request, though, on behalf of the entire commission here is for you to share with us after you've done what you've set out to do and finalized where those grants are going. You've heard the concerns that have been raised. Some of the data, some of the information in those grant applications is still private information, but it would be nice to hear back from you as soon as those decisions are made. And I'm certain that if there's not a comfort level that's reached by folks around the table, that will be a topic yet again at the next oversight meeting, which we'll talk about at the end of today's meeting.
And
Senator Benson and
Mr.
Senator
Chair,
Sharon.
to that point, once the contracts are given and the grants are let, this board has no authority to call them back, or this oversight committee has no authority to call them back.
Although, frankly, Senator Benson, I don't know that we necessarily have the authority to tell them what to do. We have oversight, but it's not like we're the board that controls the board. And as much as we might like to have that sort of, I think the direction that we're certainly sharing with them today is not going unheard.
And Mr. Chair, I don't
Senator
seek to be a
Benson.
puppet master and to have my favorite organization given a grant. I want to do oversight, but once the grants are let, we have no authority to change that.
Fair enough. Senator Sharon.
Yes, and I understand that the grants are not enough to give money to everybody, but I'm concerned, I hope I was clear, I understand that this is not the whole Navigator system or the whole system that we're trying to develop to get people access to somebody that can help them access MNsure. And so beyond this, I'm assuming at some time we'll be able to talk about the entire concept. I think a critical leg of the success of MNsure is in the success of the Navigator or person-assisted program and the development of those who are and licensing of those who are eligible or not eligible, but will in fact carry that out without conflicts of interest to drive certain illnesses towards one market or another market. But my concern is that it be geographically dispersed. And if you can't find people in southern Minnesota to come to the table, or northern Minnesota to be navigators for whatever reason, that there is clear information somewhere for where somebody can get an assister or a navigator to help them in their language, out of their culture, that it doesn't have to be somebody from Mankato that helps Mankato if there's nobody in Mankato to help them. But I want to watch this very closely because there'll be a lot of criticisms about how ineffective this program was, coming from all quarters. So I think that our success in being able to roll out the Navigator system in a way that people can connect with somebody to help them get where they need to go is critical to the long-term success of the program. And that's why you're hearing me be sort of a one-note Sally about this deal. So.
Ms. Todd-Malmlov, and if I might, before you, I did want to ask, members, a PowerPoint was sent that Ms. Malmlov had prepared. I'm not a real PowerPoint. I can prepare them, I can watch them, but the point of a PowerPoint is to share information. If folks would like to have her go through that, that's fine. But many of the topics we've already been covering, and I wanted to give members the prime time opportunities to answer or ask their questions and share their concerns.
Excuse me,
yes, Senator Sharon?
I hate to disrupt not too much to not do it, but I just would like to say one more thing to the chair about conflict of interest before we leave that.
Yeah, and I'm not, by the way, if we want to go back and forth on this agenda, folks, it's a relatively informal, and that's why we skipped down to number 4 for a while, and if it gets too carried away, I'll start to exercise a little bit more control. But Senator Sharon, go right ahead.
I just would like to say that I think that that's another critical element. We had much struggle about that during the legislative process, and the desire was to protect the function. One of the critical functions of this MNsure board is to protect this process for the consumer of the product. And that has to be the priority and understood priority of the members of the board. And if the filter that people are looking through is to take care of a provider or an insurance company or somebody who sells products or somehow is going to reorganize their business to take advantage of this, that is a problem because its success lies in the ability of that board to remember who they need to look out for. And so I just want to emphasize that to you. I heard you talk about it. I heard you talk about its importance. But I can tell you we're already hearing concerns about the memberships not being fully disclosing about what might be going on in their business life that would affect the filter through which they're going to be giving their information. So I just wanted to emphasize that that's just, I think, imperative that we remember who this is to make sure that the consumer, that the people of the state of Minnesota can purchase quality, high-value insurance at an affordable price. So.
No, Senator Sharon, Chairman Atkins, I couldn't agree with you more. Every speech I give, both at the board and informally to others, I start off with almost the exact same words you just used, and we've sort of tattooed across our head as board members that this is about ensuring Minnesotans, consumers can easily find, choose, and select something that's of value to them. And that's where we start. And that was something, quite frankly, that wasn't in the legislation, that at one of our first meetings, the board member said, let's put something together for all of us, one sentence, simple enough for all of us to understand and literally tattoo on our foreheads so that at every meeting, at every encounter, at every thought we have, we don't lose sight of that. And you can see that reflected in our minutes, in our mission, and I couldn't agree with you more. Thank you.
Thank you. With that, we've got the next item up, and we'll revisit, certainly. Senator Nino?
Thank you, Mr. Chair. Before we let the two members go, Mr. Beutner, you had earlier in your comments, you talked about the board developing a conflict of interest policy that went above and beyond what was required in the state statute. Are there members on the board that you looked at and applied that standard to and said, well, there might be a concern about conflict of interest, but they passed, they're okay? Or have you done that?
Senator Nino, Senator Atkins, absolutely. We've had the discussion about conflicts at the board. I've had it with a number of members individually to really stress that part of our conflicts policy where we're asking board members to raise their hand and say, here's what's going on in my personal and my professional life. I need to continually reassess and reevaluate it. And yes, I have had that conversations with individual members as well as with the board as a whole.
Senator?
Mr. Chair, well, there's one board member, if my information is correct, that I've been given as a CEO of a company that provides primary care. Does that comply with the statutory conflict of interest?
Senator, I've had a conversation with that member. His organization does not provide care. It provides a financing mechanism to the primary care healthcare providers. It may seem splitting hairs, but it's exceedingly different. I mean, it's essentially somebody who's providing the finance mechanism. They do not have a license to provide care. They do not provide care. So, that is something that we've discussed at length with him.
Senator Nino?
Mr. Chair, there's another member who worked for a hospital 11 months prior to joining the board, but the state requires at least a year's difference. Have you had that conversation?
Sure. Senator Nino, did indeed have that conversation, and that member in question actually, when appointed, the board had no authority, and she had no ability to exercise any authority until the transfer of authority occurred, which was 2 weeks ago, past the 12-month restriction in the legislation.
Mr. Chair, but she was a member of the board less than 12 months out from her employment.
A board without authority, yes.
Does that comply with state law in your opinion?
Yes.
Don't worry about me, guys. You just...
You said it was informal, Mr. Chair.
I would remind members, by the way, as my recollection of the statute of the MNsure law that we passed, I believe it's got to pass confirmation in the House, and does it have to go through the Senate too?
We are having an end session, Mr. Chair.
So I anticipate we'll have some of those questions or concerns that members may raise. Senator Nino, then Senator Benson.
Thank you, Mr. Chair. I have a couple of more follow-up questions. There's another member of the board that helps administer a primary care clinic. Have you had that conversation with that member?
Chair Beutner.
Senator Nino, yes, I have.
And, Mr. Chair?
Senator Nino.
And how was that comply or not non-comply with statute?
Chair Beutner.
Senator, it's the same kind of conversation that's reflected in our conflicts policy and encouraging that active discussion for whether that individual member has any influence, any day-to-day activity involved in those activities and those decisions of the greater organization in which he serves. And he feels comfortable and we feel comfortable. And, one point of our policies is exactly that, is making sure that all of our members are comfortable understanding them, understanding their roles and the roles of MNsure so that they can raise their hand.
Senator Nino.
And Mr. Chair, last question, Mr. Beutner. You yourself are a consultant in healthcare financing, and you're the chair of the board. For the sake of transparency, have you or will you release your client list? And if not, why is that not a concern for us?
Senator Nino, to be blunt, 2 weeks before I received this appointment, I sold my previous business, and they said, "What are you doing today?" I'm offering my services in consulting. If I had any time other than this, I would love to have clients, to be honest. And you'll be the first to know when I do.
Yeah, hard to have a conflict if you have no clients. So,
yeah.
Thank you. Thank you, Senator. And Senator Benson, and then, or is it on this particular? I suspect Senator Benson is on this subject too.
If I could.
Little arm wrestling.
No, I had it on that.
We'll go Senator Benson, then Senator Sharon, and then I do want to get into the item 2 on the agenda as well. Senator Benson.
I'm just asking for, not offline, I'd like some clarification. You said there's a distinct difference between financial consultation and patient care services. Earlier when you were talking about the differences, would you, not now, but sometime, articulate those differences to me so I can be more comfortable with that? I also agree with you that there is not a there's not a conflict.
Be happy to.
And for the record, for those, I'm sure there will be hundreds or thousands that will review this tape later on. That was Senator Sharon that was making that comment. Senator Benson. Legislative history is a fascinating thing that people just love to come back and listen to. Senator Benson.
Thank you, Mr. Chair. You obviously have a little more time than I do if you're reviewing legislative tape.
I'm being a bit facetious, Senator Benson.
But, Mr. Chair, to inform the board, the statute as written, within 1 year prior to or at any time during their appointed term, board members appointed under subdivision 2, paragraph A, clauses 1 and 2, shall not be employed by, be a member of the board of directors of, or otherwise be a representative of a health carrier. So the term actually began in May, and so I think we have some questions that need to be answered.
Thank you.
regarding some of these items. And with the question about the person supplying, who was CEO of a financing, a healthcare, managing the finances of, it is possible that if that primary care entity that he provides support to received a grant, they might need some financial support. And so I think we need to be really cautious of how closely to the line we get with board activities.
Thank you. Other questions? Representative Loeffler, and then we're going to go
Thank you,
to
Mr. Chair. I know
item-
you want to move on, but while Mr. Beutner's here, a policy issue that I think you need to deal with in the outreach and navigation, and it wasn't really reflected in the funding announcement, is really performance-based contracting and accountability. There's a lot of emphasis on financial reporting, and that's important. We want to make sure every dollar is accounted for and used right. But in terms of the actual impact, I mean, to me, this is the key to the success of MNsure. It isn't what, I mean, I'm thrilled that we have the lowest rates in the nation. I am very pleased that we've got a lot of things going really, really well. But it doesn't matter if it doesn't lower the rate of uninsurance, which is the whole goal. And so if we have organizations that have been enrolling people and they've been enrolling 50 people a month for the last 50 years, they don't get credit for those 50. I mean, it's got to be above baseline performance. It's got to be, how are they outreaching beyond their usual community of concern? And we have experience in this. I've watched over the last 15 years professionally how outreach efforts have gone up and fallen down, and some of them have been incredibly successful and other ones haven't. I think the Department of Human Services and the Department of Health, your partners in this, can give you some really strong feedback from actual real results within Hennepin or within the state of Minnesota, and that you really need to know your population. In Hennepin County, this is 2010 data, only 3.8% of the uninsured had college degrees. The majority of them don't even, the largest group doesn't even have high school. And yet we've got a system that's totally based on the internet, on understanding things like co-payments and deductibles and things that aren't part of everyone's normal lingo. And I mean, in my city, they did a survey. And in spite of the fact that we have a lot of really highly educated people and people with really strong careers, we have 16% who don't have access to the internet by phone, at work, or at home. And, some of them work at jobs like mine. When I go check in, I have to certify every day that that is only for the use of my employment and not for anything else. So I'm not going to be applying for MNsure on that. And so, I mean, I think you have to challenge these agencies to also learn who their target population is, because some of them I don't think quite understand how there's just still a huge population in Minnesota that doesn't use the tools that have become commonplace to others.
No,
But I'd really love to see performance-based contracting, and I think the board can lead that.
Chair Beutner, briefly on that point.
Yep, Representative Loeffler, Chairman Atkins, I agree with you 100%, and that's why I don't want to get lost in this discussion about 30 grantees of $4 million. The bulk of our outreach and our assistance and our navigator funds are performance-based, based on signing up new members, people who weren't in the system before. And I couldn't agree with you more. I'm a free marketist at heart. This is a new marketplace that we're creating. The best rates in the country have come from competitive pressures of all of the carriers that are participating, and our navigator program is fundamentally built on the same: deliver performance and you'll get rewarded.
Thank you. And a nice segue to our next topic. Thank you both very much for your time this afternoon.
I'm not going anywhere.
Yeah, I figured you'd travel 6 steps to your seat, but we've got a brief review of the premium rates that were released by the Department of Commerce on Friday. We've got staff here from the Minnesota Department of Commerce. Gentlemen, I'm not sure who's going to kick it off, but if you could just identify yourself for the record and then take it away.
Mr. Chairman, for the record, Peter Brickwitty, Director of Government Affairs for the Minnesota Department of Commerce. I have Deputy Commissioner Tim Vandehay along with me, and I will hand it over to the Deputy Commissioner here in a moment. We, as many of you are aware, the Commerce Department and the Health Department released rate and product information about the products that will be offered through MNsure on Friday, and we are here with good news. Minnesota consumers will have access to products that have the lowest rates in the country. And I will, at this point, let Commissioner Vandehay take us through the presentation.
Commissioner, welcome.
Welcome, Chair. Thank you for this opportunity to come speak here today about the rate and product information we provided Friday. Commerce is thankful to the nonprofit Minnesota health industry that not only voluntarily agreed to make products available on MNsure, but also voluntarily agreed to allow us to provide this valuable information to our residents prior to MNsure's enrollment on the start of on October 1st. I believe all of your members have been provided the information that Commerce prepared to assist in understanding what we would see when MNsure begins to accept enrollees on October 1st. We feel this is a good news for the state of Minnesota, as residents will find numerous products in their areas competitively priced to meet their health insurance needs. It is important to note that these rates are available to all residents based on where they live, with no consideration as to their health condition. The first comparison that we showed demonstrated the average health insurance rates for the metropolitan area with the metropolitan areas released around the country. It is important to note that not all states have provided information about their rates, but we feel good about our comparison. Clearly from the charts you can see that Minnesota at all metal levels are lower than any other state's reported amounts so far. The second item we discussed is the lowest monthly premium by age and metal level within the Twin City metropolitan area. 25-year-olds will find products at the bronze metal level at $90.59, where 60-year-olds can find that bronze product at $244.89. One of the other items that we were very impressed with was MNsure covers Minnesota. The availability of carriers in the individual market across our state, it covers the entire state. 85% of counties will find 3 or more providers competing for their individual business. 75% of counties will find 4 or more individual carriers competing for their business, and nobody will find less than 2 carriers competing in the individual market. The next item we discuss is the value we think our nonprofit Minnesota health carriers have made available in comparison to other states' released information. We found that not only are bronze rates clearly lower than other states, but the silver and gold products that have even more benefits to the consumer are priced competitively in relation to those bronze rates. And so as you can see from our graph, the bronze rates are clearly below the average rate of bronze rates across the country. In addition, our silver beats their bronze rates across the country, and in most cases our gold medal products will also compete very well with the bronze levels around the country.
Mr. Vandy, or Commissioner Vandy, can I just have you pause for a moment? One of my pet peeves is we just use bronze, silver, and gold. And I suspect everybody around the table knows what that means, but a lot of folks don't. Can you give a brief definition of what that implies?
Sure. A bronze medal level product assumes that there's an actuarial value of 60% contained within the product. That then raises to 70% for a silver, 80% for a gold, and 90% for a platinum. Those are estimates so that consumers can have an understanding of what they believe their cost share should be underneath the product, with all things being equal.
Thank you.
The last item we discussed in our rollout is the strong level of competition within the MNsure for your business. We first attempted in this chart, which provides the bandwidth between the lowest and the highest cost per metal level by state. The first thing we did was we removed the states that only have one carrier. As we indicated earlier, we have numerous carriers within MNsure, and to compare to just one carrier would be a non-meaningful comparison. The next step, as you can see, is that across the country in the various metal levels, we have 5 carriers in the metropolitan area. All of them are within very close range of one another with the products that they're offering by metal level. What that does is it provides great consumer choice with regards to the products that will fit their needs, and we think that that type of level of competition is fairly unique to Minnesota's exchange. For those reasons, we feel this is good news for Minnesota, and we would encourage consumers, regardless of whether you feel you will qualify for a federal subsidy, to check out what MNsure will have to offer you, your family, or your small business. We feel the products and rates found in MNsure will be competitive and provide consumers with many choices to consider in its first year of existence. And with that, we'd be happy to answer questions.
Thank you, Commissioner. Are there any questions for Commissioner Vandehey or Mr. Brickwitty? Senator Nino?
Thank you, Mr. Chair. And I don't know who would be best to answer this, but I've had conversations with individuals who say that they've been told that our rates are low compared to the rest of the country, but they've been told that those rates are being essentially artificially bought down out of cash reserves. Do you have any reason to believe that's correct or incorrect, or any comment on that? This is something that they've been told by people that would be in a position to know.
And I guess, Commissioner, this would be best for you. Commissioner Vandehey?
Chair, Senator, the rate review process in Minnesota, because of its long history in healthcare reform, as well as having the minimum loss ratios and an effective rate review process in which we can actually turn down rates, has benefited Minnesota by providing very competitive rates. There are numerous assumptions underlying those rates, some of which are brand new for 2014. Those include the loss corridors, the loss adjustment, and the federal reinsurance programs, which are federal financial mechanisms meant to mitigate some of the potential interruption of the marketplace due to a guaranteed issue and some of the other measures being put into place. So there is that great level of uncertainty associated with trying to capture within an actuarial science the assumptions of those. We believe that the rates accurately reflect adequate rates for the market going forward, and it would certainly be appropriate to say at any given time a company making a rate decision, because these are rates that the companies are providing for their products. If those decisions would turn out to be wrong, their reserves are where that would be mitigated on the financial statement.
Senator Nino?
And so would it be fair to say that an actuarially sound rate could be artificially low but subsidized through reserves, and the company still would be actuarially sound? That potentially could happen.
Commissioner Vandehey?
Chair, Senator, I think it's very difficult to say that the cash reserves are used to supplement or lower the company's rates, as those are not part of the rate-making process. That is certainly the surplus or the equity position of a company allows to soften when for financial instances in which estimates turn out to not be accurate. However, in the rate process itself, I do not believe that was a consideration at all.
Senator Nino?
Thank you, Mr. Chair. And if their rate estimates turned out to be inaccurate and they had to subsidize that with the cash reserves, that would not be a sustainable proposition over the long term if that were happening. Is that a correct assessment?
Commissioner Vandehey?
Again, your question is quite challenging, as you're characterizing the cash reserves as some type of subsidy to the rate-making process. Any professional company's equity position does offset difficult times, and those would include times in which their estimates may not be as accurate as they would like.
Okay. I was not looking around. Is there other folks that had questions or concerns for Commissioner Vandehey or Mr. Brickwitty? All right.
Is that the end of the presentation?
With respect to the rate review, yes.
Then I would like
Senator Sharon?
when you're describing these outcomes, which are, they're an aggregate, correct, in terms of, and you talk often about the metropolitan area having special rates, and that what we're talking about is an aggregate as comparison to other similar states?
Mr. Chairman, Senator Sharon, I think the reason why in our materials and during the presentation we're using the Twin Cities metropolitan area in comparison to other metropolitan areas around the country is because other states released averages for their metropolitan areas. We were looking for the most appropriate apples-to-apples comparison between Minnesota and other states that have released their information. So, for example, the chart that Commissioner Vandehay referenced on the first page, the bar graph across metal levels, that's the Twin Cities average compared to metropolitan areas across the country. With regard to other regions of the state, there are 9 geographic rating areas, which you know, and each one of those rating areas has slightly different costs because of the different factors that the plans use to calculate their costs and their rates in those areas. And so I believe in the materials that you have from MNsure contain the breakouts of costs across all of the geographic regions in greater detail than the materials that we provided you with today.
Senator Sharon.
Thank you. And as you look at those regions and you see the differences, some of them significant in the monthly costs for the elderly and for families, what is your reaction to that? And are you as concerned as I am about that for my region?
Mr. Chairman,
Mr. Brickwitty.
Senator Sharon, I think I think the Commerce Department certainly is interested in making sure that consumers across Minnesota have access to high-quality options. And we think that with 85% of counties in Minnesota having 3 or more plans or products available to them to choose from, we're on the way there. Certainly doesn't mean that we're all the way there, and there certainly are 50% of counties that have two options to pick from. We certainly would like to have as much competition as we can, because we think that will encourage better outcomes for consumers at the end of the day. I think across the state there is some variation. For example, I just have some of them here. Looking at Region 7, which is the sort of the middle part of the state. Senator Lori's district is in Region 7. Some of the cost for a bronze plan for a 25-year-old, for example, which in the metro area is $90.59. The cost in Region 7 is $95, or the lowest cost option is $95, I should say. There certainly are some differences across the state. And I know we're going to be meeting with you tomorrow to talk about them specifically in your area. And there are a variety of different reasons for why different parts of the state have slightly different costs for insurance products, much as there are today very different reasons why different parts of the state have different costs for consumers.
And just one follow-up. I know we're going to be meeting to talk about this subject tomorrow more specifically, so I can get after it. But I know the criteria that was allowed to be used in establishing rates included geography, age, and such. But not pre-existing condition. That was one of the positive things. But does the Commerce Department, when rates are being established, have a challenge or in any way really question the rate setting, even though there's only 2 providers in Blue Earth County, as to their justification for the rates that they're establishing, or in Rochester, which was reported in the Pioneer Press, that the assumptions that they're making ought to be challenged, it seems to me, because if cost of health care in that area is one of the issues that the providers are looking at in terms of setting their rates, and they're saying the cost is more expensive in certain areas, so it justifies a higher rate, then how can we as a state on the other end use the cost of health care as a justification to say that rural Minnesota healthcare costs are lower, so we don't have to pay those hospitals as much in our rates as we have? So our basing of the rates for hospitals is on the assumption that the cost of healthcare is lower in rural Minnesota. But when we take a look at how they're establishing rates for health insurance, and justification, they're saying using the exact argument only in the reverse. So in our area, for example, the Mankato area, we're on the lowest end of the rates that we pay providers in hospitals for care, very low 25%, because the cost of care is less expensive in rural Minnesota. And yet on the other end, in terms of what we're charging people for their insurance, we say that the cost of care is very expensive. So I'm really struggling to understand if the Commerce Department has really challenged these providers, limited as they are in the rural area, on their assumptions that they're using for establishing those rates. And I'm hoping we have some substantial conversation about that. There's a part of the state that would not be jumping up and down about the rates that we are in aggregate talking about.
Mr. Chairman,
Mr.
Senator
Brickwitty.
Sharon, and I would expect us to have a robust conversation on that and other points. I would just say that the state has had a very effective rate review process, and we do subject rate filings to a strong amount of scrutiny throughout the process. I think looking at the outcomes is the right way to do it. I think we have extremely competitive rates, the best in the country. I think they'll hold up as we learn more information about some of the other states that are yet to release their rates. But I think you raise a good point. But the Commerce Department does take a very exacting look. And as evidence, as Commissioner Van de Hey mentioned earlier, the Commerce Department has the ability to reject rates. And so if the rates are coming in and are not appropriate, we have the opportunity to reject them.
Is that the case now? Is that still the case, that you can reject some of these, or have you accepted these rates?
Mr. Chairman,
Brickwitty.
Senator Sharon, the Commerce Department can reject rates that are filed with the department, yes.
I'm not sure my question was understood, so I'll repeat it again. You have that authority. I'm wondering, have you yet the capacity to exercise a rejection of the rates as I'm seeing them in this report? Or are these accepted rates?
Commissioner Van de Hey.
Chair, Senator, those are approved rates.
Thank you, Senator. And I should state also, I know that, at least speaking for me, I was concerned that there'd be any plans filed in some counties, or some regions, I should say, and or only a single plan. So it's not perfect, but I was glad to see that. I think there is no county, gentlemen, that has fewer than two. Is that correct?
That's correct.
But there's still 15%, to Senator Sharon's point, that only have two, and it'd be ideal to have even greater competition in those counties as well. Senator Benson, I think I interrupted you. Had your to that point, Senator Lord?
Two, though, it's important to note always that that's two carriers with multiple products each. So it's
good point.
People miss that. I've heard that many times, that people are always thinking there's only two products. There's two carriers with multiple products at each metal level. Probably, I haven't seen
Mr. Chairman,
all of it.
Senator Laurie, that's
the key point.
That's an
correct.
important point,
Thank you
Senator.
for that clarification.
Senator Benson?
Yes, Mr. Chair, and I'm not sure who to direct the question to, but did New York, Albany release their rates?
To the
Because I
extent
thought I
that-
had seen a chart that New York, Albany had also released their rates.
Commissioner, do you happen to know that? Or
We've done an extensive review to try to identify all of the rates that were released. If there are some, we can get back to you on that one. I'm not familiar with that right now.
Because we're looking at a really small pool here. And so I had seen Albany on a chart from an actuary and thought that their rates would actually be a little more comparable than the city of New York, I think. So I think we've got a little bit of marketing going on here in the rate review. But so that wasn't a specific question, but now I do have a specific question. I happen to serve two counties. I have 4 townships in Isanti County, which is in Area 7. But those townships might have a provider in Anoka County because that's the closest to them, or it's on the way home from work in a different area. And I should know this, but if somebody could help me, if one of my Isanti County constituents signs up in Area 7, can they go to a provider in Area 8?
Commissioner or gentleman?
Mr. Chairman,
Mr. Brickwitty.
Senator, I would somewhat defer the question about providers and networks to the Department of Health. That's part of their review of product filings. The network adequacy is a question for them. But
Commissioner?
Chair, Senator, I could provide a little bit of clarity around that. Is that the networks that the plans were producing for their products were not required to stay, I believe, within the same geographic rating area. It was the rating areas of the state. And so I believe that, but as Peter indicated, Department of Health would be a much better resource for network questions.
Thank you. And Senator Sharon, on that point, I've actually got Representative Loeffler on the list, but
I'll defer.
okay, Representative Loeffler, and then we'll finish up with your question and go on to the next.
Thank you,
Representative Loeffler.
Mr. Chairman and Deputy Commissioner. We've gotten a lot of publicity, and it's been great about the individual policies and how they compare. But I haven't seen as much on summarizing, even in the material that we've got, about how our small business competition is and whether or not, I mean, traditionally small businesses got a better rate by buying the group policy rather than the employees each going out individually and buying a policy. Is that still going to be a true assumption given what you've seen come in on the rates? Can you just give us some information, or if you don't have it today, if you could follow up with that, because I just really haven't seen much on the opportunities for our small businesses, and about half of our uninsured are actually employed.
Commissioner.
Chair, Representative, one thing to remember when you're thinking about the small group market is that the default plan that established the essential health benefit set came from our largest enrolled small group plan. And so we found that many of the small group plans, the products that they had, their benefits were very similar to the ACA required benefits. And so we saw limited, minimal increases related to 1 year from the other for a small group, given beyond the normal loss trend that we would typically see. So we feel that while we have 3 companies participating on MNsure, that they will have competitive rates for small businesses as well.
Mr. Chairman, just to follow up, that's good intellectual sort of feedback, but for the small business person, the soundbite is the rates look like they're like the individual rates, some of the better ones we've seen in the country. They're, can you give me kind of better the layman soundbite that a small businessman or woman running a coffee shop might understand?
Mr. Chairman, Representative, I would say that you can tell small business owners in your district that the rates are very competitive. I would also add that in the materials that MNsure has provided today and have available on their website, there is information about product availability for small business owners by the geographic rating areas. In addition, information about the small business tax credits. We haven't spoken at all about the premium tax credit assistance that individuals and small businesses may be available. That information is contained in the MNsure packet and is available on their website as well.
Thank you, Mr. Chair. And if you could kind of flush that out as we move forward with your information, that would be really helpful, because I think people are wondering, is it still better to do it as a group, not, those sorts of things. And that area just hasn't gotten as much attention.
Fair enough. And Senator Sharon, our last question on this topic, and then
Thank you, Chairman Atkins. In the past as in the present, when there's a differential justified for the rates that are established between these various regions. It's been difficult for those who get the hit of the higher expenditure or get classified as the more expensive plan, so you pay a higher copay. It's been difficult to get data by those who are being penalized, I say, with a higher rate, to determine what it is that's happening that causes their situation to be more expensive than someone else's. Is the data available and exposed from all these providers of these plans, and all of the data about how that determination has been made available for those parts of the state who are struggling to figure out why they're paying more for the same product that others in other parts of the state are paying?
Commissioner?
Or is that still considered proprietary information?
Chair, Senator, we have not released all the information to make that available until after October 1st, as this was a voluntary effort by the state of Minnesota, as well as the plans to allow us to even release any information prior to October 1st. With the geographic rating areas, some of the fundamental drivers of that really come down to the number of providers in an area and the number of people in that area. And so as you have higher concentrations of individuals as well as higher concentrations of providers providing services to those, you'll typically see greater competition that oftentimes results in lower rates. And so I do believe that that information will be provided. And that's really one of the, I've heard a lot today about people wondering what this means for them individually. That's part of the excitement, is we think that when October 1st rolls around, you can go to MNsure and find out for yourself what this all means for you. But we think you're going to be pleasantly surprised regardless of whether you are eligible for federal subsidies.
Thank you. Representative Mack?
Thank you, Mr. Chair. Just a brief question. I'm looking at page 5 of your handout here, where it kind of lists the carriers in the individual market and the small group market and the number of plans available. And then there's a lot of information that's comparing Minnesota to other states. I guess I would be more interested in further information in terms of what what carriers are available within MNsure, and then what it looks like outside of MNsure, and kind of a better comparison between inside MNsure and outside MNsure, and on an ongoing basis to give us an idea of what effects being had, how they compare, so that consumers know, so that we just have a better idea as decision makers what effect is being taken. So if any thoughts you have on that would be helpful.
Mr. Chairman, Representative, excellent question. The Commerce Department is still reviewing rate filings, as well with the Health Department, rate and form filings for products that will be offered outside of the exchange. We expect that information to be available on October 1st.
Is it fair to say, by the way, that some of the products inside the exchange will be offered outside as well at similar, same price?
Mr. Chairman, that's quite correct. Products that are offered inside the exchange that are going to be offered outside of the exchange have to be done so at the same price.
Representative Mack?
Mr. Chair, just a follow-up. Can you tell us a number of, comparison we're looking at, on this sheet here, 5 under the individual market, 3 under the small group market. How does that compare? How many carriers are there? How many applied outside of this?
Mr. Commissioner Vandenhey.
Chair, Representative, the first comparison I would make is to the amount of premium being written by the carriers outside of the exchange in 2013. And you'll find in the individual market
Commissioner, can you speak into the microphone?
Oh, sorry. You'll find in the individual market that Blue Cross Blue Shield, Health Partners, Medica, and Preferred One make up 91% of the new business being written in the state. In addition, you'll notice that UCare is now on the list in participating in the individual market, and that's a new entrant into the individual market, as they've only been the public programs and Medicare Advantage. And so I believe that you have significant competition within the marketplace itself, MNsure.
Thank you. And Senator Benson, about 3 people ago, I said this is the last question, but this is the last question. Senator Benson.
Okay, then I have 6. No, just kidding.
It's a multi-part question.
Really long question.
This might be something for actually MNsure, and I tried to find this on the website, so I might need to take some navigator certification, but I tried to look up my doctor to see if it matched up with a plan that would be available to me. And I didn't know where to start. So can somebody do that on this website?
Commissioner, or if there's a better person?
On the MNsure website or on the Commerce website?
On MNsure. When you go into the exchange, are there going to be providers so that if you choose a plan, before you sign on the dotted line, you can say, okay, my doctor, my clinic is in this plan?
Mr. Chairman, Senator, I think I understand your question. You're asking, will a consumer such as yourself on October 1st be able to go onto the MNsure website and see that comparability and whether or not their provider is included in the network of a particular product? Mr. Chairman, I would defer to MNsure to answer that question.
So you took that long to repeat the question back?
Mr. Chairman, just wanted to make sure I understand Senator Benson always asks.
You'd make a fine lawyer, Brickwady.
Interesting. What a polite way.
So when we get the MNsure folks back up, I think that's because I'd like to be able to keep my own doctor when I buy the product through the. All right, gentlemen, thank you very much. We appreciate your time today.
Thank you, members.
Next up is item 6 on the agenda. It's and I think this can be relatively brief. It's an update on the marketing campaign and materials. I actually asked to have this one on because at the time we were putting the agenda together, there was a question about what was going to be released to members, what was public and what wasn't. and some legal issues that were being raised about what technically is public and not. I think at this point everything has been released. The whole Paul Bunyan thing, and I'm looking to Ms. Todd-Malmlov to nod. I guess what I'd rather do is just ask: are there questions from members about any particulars of the marketing materials that members may have questions of? Representative Loeffler.
Thank you, Mr. Chairman. In the handout, there, the slide presentation that we didn't go through, there's a good summary of it, but I was concerned about on the print media, it looks like it's using major newspapers and regional center papers, and if our target audience is people without insurance, those are wonderful resources for all kinds of things, but in my area, every single household gets a neighborhood newspaper for free, and that reaches out to the people who can't afford, aren't interested, whatever. The major newspapers on my block, I think there's like 25 households, and I think there's less than 5 of us who subscribe to the major newspaper. There might be a couple others who look at it online, but it's not a very effective outreach, and I suspect for small rural towns, I don't know how much they get the regional center paper that's nearby, and so I'm just wondering whether or not this is cast in concrete or whether there's opportunities to broaden it to, I think, vehicles that are actually more likely to be picked up and viewed by people who are engaged in their community and will be looking for local information as opposed to statewide information or regional information.
Sure. Ms. Todd-Malmlov.
Mr. Chair, Representative Loeffler, what you've seen, I think you're referring to page 14 that's on here that has some of the newspaper ads that are there. So what really the examples that are under there are really examples. So it's examples to show across the state the newspapers that that are already kind of under contract, as well as the local, some of the local community newspapers as well. At the moment, we have about 25% of our spend that is done for September. We're still negotiating some of those later ones out, but definitely all of the ad buys, the intention there is to hit mass media as well as local community radio and community newspapers as well.
And, Mr. Chair, just to be clear, because people interpret community differently, there are communities of ethnicity and color, and there are geographic communities. And when I reference the community newspaper, it typically is like my Northeaster or the Downtown Journal, or, you know, they serve a geographic area, and they actually reach into every single household.
Thank you. Senator Hayden.
Well, thank you, Mr. Chair, Ms. Todd-Malmlov. I have two, maybe a concern and then most certainly a question. So I anxiously waited to see what our marketing strategy was going to be, and I think we all saw Paul Bunyan and Babe the Big Blue Ox, and I think it was a well done ad, and people kind of remembered it. But I do distinctly know that a lot of people in the communities that I represent didn't know who Paul Bunyan was, didn't know who Babe the Big Blue Ox was, and so, you know, I happened to grow up and went to kindergarten in South Minneapolis in the early 70s. I guess I'm telling my age now, so I was familiar with them. But a lot of people that live in my community didn't grow up here, are new immigrants, are new to Minnesota, and so I guess my question, beyond critiquing if I thought it was the right message, is: are there other kind of messages? Are there other creative content that are going to go out, that go to people maybe that are new to Minnesota, maybe they're immigrants, maybe they didn't grow up here, maybe they just don't identify with a 27-foot tall, large white guy with a beard and its companion, the ox?
Ms. Todd-Malmlov.
Mr. Chair, Senator Hayden, so a few points there, just a couple of those. First is when we did, in determining kind of what we would do for the marketing and the outreach strategy, we did a lot of research in a multitude of ways, through key informant interviews, focus groups, through surveys that included communities across the state, all populations across the state. To your point, the ads that we tested, the Paul Bunyan one by far tested far and wide the best among all the populations, even among those who might be new to Minnesota that didn't quite know who Paul and Babe were. The message that was carried through that resonated with them. That said, Paul and Babe is not the entirety of the marketing and the public outreach messages that are there. We also have specific targeted messages in different parts of the state and with different populations, both through newspapers, community radio, community TV as well, planned that are more targeted towards specific populations in specific languages to get that word out. And so Paul and Babe definitely is the kind of the mass media, but there are also targeted strategies that are planned as well.
So, Mr. Chairman, Todd-Malmlov, when does that strategy start to evolve, and how do we know? And with all seriousness, I mean, I was pretty tongue-in-cheek with with Babe the Big Blue Ox, but really, in essence, I think it would be important to understand when those kind of ad campaigns or when those strategies will start to manifest. Because we are running, pretty quickly to the first, and then in addition to that, like, who helps with the creative content to make sure that the things that you have done are going to be relevant and culturally appropriate?
Mr. Chair and Senator Hayden, I can give you a few examples. So as I mentioned before, about 25% of our buy is in right now. We're still negotiating some of the rest of that through the end of the year. To give you an example, for example, in community radio, one of the examples that I think I have in here is on slide 11. So what we are talking through with community radio is a few different size spots, whether that's 15 seconds, 20 seconds, 30-second spots, on communicating that message out to specific communities within targeted languages, as well as targeted messages, and working with those local community radio stations to deliver that message through whether that is a respected community leader or a well-known individual within that community, a radio show host or those means to have flexibility to be able to do that in a variety of those mechanisms.
Okay, and then Mr. Chair, thank you. Then my last question on this is that. You know what? I'll just let this move along, and we'll just watch how that progresses. Thank you, Mr. Chair.
Just a quick follow-up. Are there other community spokespersons now? I mean, when I was at the state fair, Quincy Lewis, right, from the Timberwolves was in the. I don't know if he was volunteering in the booth. I don't know if he was one of the official spokes. But are there other than Babe and Paul? By the way, Chris here noted that he does identify with the 27-foot tall.
And with all due respect, Mr. Chair, he probably has health insurance as well. So.
But I'm just curious, are there other official spokespersons at this point for MNsure?
At this point, not official ones that would be on every radio station, kind of every newspaper, but we are working in local areas to make sure that we have those in targeted communities.
Thank you. And
Mr. Chair.
Representative Mack, and then Representative Loeffler, and then we'll move to the budget issues. Representative Mack.
Thank you, Mr. Chair, and Ms. Todd-Malmlov. I'm just wondering, are you guys doing foreign language radio also?
Ms. Todd-Malmlov.
Mr. Chair, Representative Mack, we are doing radio in multiple languages.
Okay.
Representative Mack.
Thank you, Mr.
Representative Loeffler.
Thank you, Mr. Chair, and Ms. Malmlov, as you're looking to potentially consider other spokespersons or images, I would just say that look at the research that says the majority of decisions about health insurance for families are made by the women in the household, and using sports figures that are mostly attractive to gentlemen in the household may not get the message to the person who's actually going late at night after the kids are in bed to check out the MNsure website. And so we got to kind of figure out where does it go to our broad population.
Thank you. Thank you, Representative Mack.
Thank you, Mr. Chair. And just to follow up to what Representative Loeffler said, as we look at the who's employed by the MNsure staff and all the different folks, there's a fair amount of people or positions, it looks like, under communications. And I guess I'm just looking for clarification. Would those positions under communications, and I see there's also a public relations officer, many of which are, making close to commissioner level salaries. I'm wondering, do some of them have expertise in some of these cultural issues or the people they're trying to address, I would imagine they're experts or should be experts in their field and aware of some of the issues that Representative Loeffler is mentioning, what's going to relate, what's going to addressing some of, Senator Hayden's concerns. I guess I would hope that we have people in these positions already who would kind of be on top of some of these concerns and one step ahead of us measly legislators here, knowing what's going to relate to the people out there who are in need of these services. So if you could speak to that at all, or what kind, some of the people in these positions, do they have expertise in some of these cultural barriers that they're going to be dealing with?
Well, and before you answer, let's now say that we've officially gone to item 7 on that's budget item, so it's and it also talks about outreach and that kind of thing. So, Ms. Todd-Malmlov, to that concern.
Mr. Chair, Representative Mack. So I think 2 responses to that. One is we do have a core communications staff, and I'm very pleased with the qualifications that those staff have. I think they have done a great job in bringing the communications that we've had so far to the fore. But we also have some additional hiring that we are doing as well. For example, we will have essentially outreach or communications liaisons in 8 to 10 different regions of the state, and their job really is to be living and breathing in those local communities and to be kind of our frontline staff there to help us understand what's going on in those communities and make sure that we are getting communications and materials out all across the state. And so those are also in the works of being hired across the state.
Okay, thank you. Are there other, and we've now kind of transitioned to the budget discussion. I don't know if you had a formal, I know there was some items in your in the PowerPoint that you shared beforehand. Questions on budget issues, Representative Loeffler?
Well, just to that last point about regional staff, I will just point out that over half the state population lives in the metro, and I would hope that as we divide up those regions that would be reflected, because the neighborhoods and communities that Senator Hayden and I represent are very different than some of the suburban areas and have very different communication styles and engagement. And it is way too often the practice of the state to send, 7 out to greater Minnesota and 1 in the metro, and that poor metro person can't begin to even understand what the area, let alone be effective. And so I hope you'll look at that balance.
Okay. Other questions relative to the budget? And we just as an ongoing, we appreciate the fact that you've shared budget materials. We'd ask that you continue to share, whether we're having a meeting or not, and particularly as the board is now officially charged and the transition has occurred, if this would be an official request from this commission that you continue to share budget information with members of the body. Senator Nino.
I did have one question on the budget and relative to the salary schedules that we got the list here of however many 150 staff or whatever that is. Are these salaries pegged to the standard state employee salary schedule in any fashion? Are they directly related to that, or are they not? How are these salaries determined?
Ms. Todd-Malmlov.
Mr. Chair and Senator Nino, the salary schedule that is in the grant application is based on under the MNsure statute. It essentially calls for the creation of a salary plan for managers within MNsure, a new plan. This last legislative session, MMB brought that plan to the legislature that was reviewed, passed by the legislature. Essentially, a grid was passed through that based on evaluation that MMB did. Positions were slated into that grid. This reflects where those positions were slated into that new grid.
Senator Nino.
So I wasn't quite clear. Maybe I wasn't eloquently expressing my question. Are they directly related to the other state employee job classifications and salary schedules, or are they not directly related, or are they sort of directly related? Is there any connection there, or is this just MNsure and the states over here and it's different?
Ms. Todd-Malmlov.
Mr. Chair and Senator Nino, MNsure has its own specific plan now. It is not tied to the state employee classifications. It has its own separate plan.
Senator Nino, any follow-up? Senator Benson.
Thank you, Mr. Chair. And to help Senator Nino, I'm on the subcommittee on employee relations, and what usually happens is the 2 largest employee unions negotiate, and everyone else's contract changes and increases peg off of those. And so there is a tangential link, just as the MNsure faculty is kind of tangentially linked, but there is a separate opportunity to negotiate.
Thank you. That's helpful. Senator Representative. Unless there's other budget questions, thank you very much. Before we move on to the final item, which is public testimony, I'm sorry, Senator Benson.
Mr. Chair, this was kind of where we were supposed to have the federal grant question. Do we still have the opportunity to do that?
You're more than welcome to ask if you'd like further information. You have questions about the federal grant. Now is the perfect time to do it.
Okay.
Senator Benson.
The biggest area we haven't covered yet is data privacy. And there was a Forbes article I circulated. There's concern about data privacy at the federal level. And as we're negotiating contracts with grantees for outreach, and as we're paying people for outreach, they're going to have access to first, last social security number, address, names of children. There's huge risk for identity theft. And so I'd like to know what is being expected, contracted, done to mitigate that risk, particularly if we have to default to a paper form.
Okay. And before, I just wanted to say thank you, by the way, for sharing that article. The concern about pushing this off and letting the feds do it is part of the reason why Senator Laurie and I carried the legislation to have it be Minnesota-based, is one of those concerns being over data practices and privacy. Ms. Todd-Malmlov, maybe you can walk through the protections that are going into place.
Yes. Mr. Chair, Senator Benson, I can absolutely cover kind of the high points, but we can also provide you more detail as well if you'd like more information. So generally around the data practices or the data privacy issues for navigators, there are a few different things to be aware of. One of them is that we have all of those agents and brokers and navigators, kind of in-person assisters, are going to need to make sure that a background check has been done on them in some way, shape, or form, so that we make sure that those individuals are being able to safely secure someone's information and they don't have a criminal history. So that's one. Secondarily, we also have federal requirements and our own state-level requirements regarding training on privacy and security. In addition to that, we have an additional component that was included in the legislation that was put in place by the Data Practices Subcommittee that requires us to do an additional level of check beyond what the federal government is doing to ensure that we are checking every individual person that would have access to the MNsure system and checking every one of those along the way for those data privacy and those practices. So we will have more stringent access for those individuals into our system than likely the federal government will, because we have those extra provisions within our statute.
Senator Benson.
And thank you, Mr. Chair. Ms. Malmlov, so what consequences are there if a navigator takes someone's information and uses it for their own personal use, or, as we saw happen at the DNR, is just surfing around, checking things out? What consequences will there be?
Ms. Todd-Malmlov.
Mr. Chair and Senator Benson, there are criminal sanctions related to that, as well as financial penalties, subject both under state and federal law. I don't have just in front of me what exactly those penalties are, but we can get those to you.
Senator Benson.
Mr. Chair, and I'm going to ask that if we find an entity with a systemic problem, that you have the authority to pull their grant. Is that accurate? And to decertify them?
Mr. Chair and Senator Benson, we actually, in the grant process and in our contracts with all the navigators, agents, and brokers, we have the ability to audit them at any time, to look at any part of their records, and we do have the ability to pull their certification.
Thank you. Are there other questions? Senator Nino.
Thank you, Mr. Chair. On that same line, do we have protocols in place to do those random verifications where you have that contractual agreement where you can come in and audit them? Do we have a protocol in place to do that on a randomized basis, or what is the protocol?
Ms. Todd-Malmlov.
Mr. Chair and Senator Nino, we are putting those in place, and we can follow up with more information for the committee.
Okay. Would you also be kind enough to follow up with the, I'm told that the criminal penalties in Minnesota are among the strongest or most, strictest in the country. I'm just told that, and that it was frankly, on a bipartisan basis, both Republicans and Democrats have passed those laws. But if you could share that with us as well, or have staff share that with us. Are there other questions? I almost called you Senator Mack. Representative Mack.
Thank you, Mr. Chair. Just a question in terms of, as the grantees are finalized and everything, are they being given print materials in terms of kind of their regulations, the criteria by which they can do their outreach? I'm wondering how they're trained, how they're educated in terms of navigating this whole process as they're trying to educate the public. Are there print materials? Are those available now? Are they still in process? And who is responsible at MNsure? I mean, who's kind of where the buck stops with the Navigator program? Is that you? Is that someone else who is totally, that's their bucket of worms? How does that work?
Whose bucket of worms? That was good.
Mr. Chair and Representative Mack. In terms of the print materials and kind of what's available, there will be language specified in all of the contracts related to what a grantee can or cannot do. So there's some language in there. There's also for all assisters. There will be training that all of those assisters need to pass, as well as competency tests related to that training material that they will need to pass. That training is being conducted online. And that material will be available to them ongoing into the future that they can use for refreshers or that type of information. In terms of accountability, generally accountability sits with myself as well as the board as well, related to the operations of MNsure.
And Mr. Chair?
Representative Mack.
Is this a kind of the Navigator program outreach, are there expected results? Is there, in terms of what they're coming back to, what they're supposed to show or what they're supposed to produce for the money that's being given to them? Are there numbers they're supposed to be hitting? Maybe that's available in something that we have here, if you can point me to that. But I'm just wondering, how are we knowing what they're, for lack of a better term, producing on behalf of this money that we're investing in them, expecting them to do a service on behalf of MNsure and the state and the overall health of the state?
Great question, Ms. Todd-Malmlov.
Mr. Chair and Representative Mack, and actually I think this addresses one of Representative Loeffler's earlier questions as well. If you look at page 14 of the RFP that was put out for the grant applicants, we do specify to the grantees that we will be tracking performance metrics, and we will be letting them know what it is that we are tracking. We intend to be tracking that generally on a quarterly basis for those specific grantees. In addition to that, as was mentioned previously by our board chair, there's $4 million that's set aside for the grants. In addition to that, there's another $11 million that are specifically designated as per enrollment payments. And so it is the payments are for successful outcomes in making sure that people are getting enrolled. And so there's $11 million designated for that.
Okay.
Representative Mack.
Thank you, Mr. Chair. And is that information in terms of the results and how many what grantee are being, how many people they're enrolling per, is that all going to be public? Is that something we as a commission will be able to see on a regular basis, see how each grantee is performing and what they're doing? Just wondering if that's public or available for us to look at as this thing rolls out.
Ms. Todd-Malmlov.
Mr. Chair and Representative Mack, I'll check into how much of that is available, but I do know that we want to use those performance metrics to improve the service that we are doing, to also use that to share best practices among the grantees and among the assisters and navigators and agents and brokers as to what's working and maybe what isn't, so that we can continually improve over time. But I will follow up with you just to make sure of what is public and might not be.
Thank you. Senator Benson.
Yes, thank you, Mr. Chair. And I have a couple of questions as long as we talked about data privacy security. Have you done an NIST standard for your data hub? And if not, what certification did you use for security of the data hub?
Ms. Todd-Malmlov.
Mr. Chair and Senator Benson, so we have gone through multiple levels of review by the federal government at this point. We've had 2 separate reviews by the IRS for data security of our systems that we have successfully gone through both of those. At this point, and I could call up our counsel, Mike Turpin, as well, who may have more details around the different documents and the information that we need to submit, as well as the review that is undergoing. But to my knowledge, we have been passing through all of those requirements.
Senator Benson.
And thank you, Mr. Chair. The federal government has to meet an NAST standard, which is an external review. Are you required to do that? The IRS, God bless them, they're not about security. They're about following rules that somebody laid out for them. The NIST requires an external standard. I'm just wondering if you've had to comply.
I think Mr. Turpin is about security, though. Mr. Turpin?
Mr. Chair, Senator, thank you. Mike Turpin, General Counsel with MNsure. You're correct in referencing the NIST standards. The standards specifically that are applicable are the NIST 53800 standards. There was a completion by a cross-federal agency group that developed an application of security standards that were based upon the NIST 853 and built that into a document called the Mars E-Suite. And the Mars E-Suite, which I believe has been provided, documents the minimum acceptable controls for data security that all exchanges are required to meet. The federal agencies then review against those documents, both the IRS review against those documents. There are some more stringent standards with regard to federal tax information as defined in those versus other personally identifiable information. Another element of completion of the Mars E-Suite is the completion of a third-party security assessment, which we have completed. So all of those build towards all based on the NIST standards. Again, it's not specifically that standard. It has been modified for exchanges so that it is very specific, and those controls are publicly available, and they're very extensive. It's about a 250-page document that identify very specific controls, both at the technical level and at the managerial and implementation level.
Senator Benson.
Mr. Chair, the feds expect to be certified September 30th to go live October 1st. Are you done with all your certifications? Straight up, have you met every security hurdle that you're going to have to meet between now and October 1st?
Mr. Turpin.
We have submitted all of the certification, and we have gotten positive responses on all of those.
Okay, so there's nothing left to do security-wise?
That's correct.
Thank you. And
Senator.
last question, this goes back to the grants. You mentioned that, Ms. Malmlov, the funds were going to be released in September of 2013 to apply for a full year. With this controversy, what date were those supposed to be released, and what date is that going to be shifted to now?
Ms. Todd-Malmlov.
Mr. Chair, Senator Benson, we had put in our grant application that we were going to be doing the initial notification of grantees on August 23rd, which is the date that we did notify on the initial grantees, and that we would have contracts done in September. We did not identify a date in the RFP for the conclusion of those contracts. We are in the midst of doing that right now and anticipate those being done by the end of the month.
Mr. Chair, not being a lawyer, the fact that you announced and tacitly committed, do we have any legal obligation to follow through if they've made plans, if they've built out office space to accommodate this? Because the announcement felt very official, and I want to make sure that there's nothing that we're committed to.
Ms. Todd-Malmlov.
Mr. Chair and Senator Benson, there's nothing that we are committed to at this point. We made the grantees aware that this was an initial notification, and we needed to work through contract negotiations before there was an official award.
Okay. Unless there's other questions at this point, thank you all very much. We do have a section for public testimony, and we've had some folks
I
that
do
have...
have a, I'm sorry.
I'm sorry, no problem at all. Senator
Yeah, I was NIST and all of those kind of things. I was trying to wrap my head around all of the very smart questions that my colleague Senator Benson asked. I do want to just kind of before we, and I know public, and I don't want to keep people here too long, but I know that we touched a little bit on the outreach grants, and I just want to just kind of outline. I was just trying to do a quick informal count of African and African American organizations. 1, 2, 3, 4, 5. I mean, these are the ones that I'm familiar with. Are 6, 7, 8, 9 at least of what I could see that are African or African American organizations, and maybe I might have missed one that requested a grant through the outreach in infrastructure, and it looks like none of those organizations were selected, Ms. Chair, Ms. Todd-Malmlov. And once again, I do think it's worth kind of having a little bit of discussion, or even if there isn't a discussion, just what appears to be really a far-reaching, it looks to that we really overlooked this community in any way. I've seen numbers between 17 and 26% of uninsured people in the state are African or African American, and I don't know if we break down. I know that we sometimes, depending on who you talk to, have different numbers. And one of the things that I have noticed as long as I've been here, I remember when I started here way back 5 years ago, sitting in this very room, and then as I've moved on to the Senate, is every year we come back and we talk about health disparities, and specifically in the African and African American community. As a matter of fact, Senator Benson and I have had some long discussions about how to start to do something about it, as opposed to admire the problem. And so in this particular issue, I think that to have that many organizations to apply, a lot of them are, organizations that are very familiar, at least to me, and I think to a lot of other people in that community, and for none of them to get the grant, I think it is a huge oversight, in that we need to really think deeply about what it is that we're doing. And I can appreciate, and I want to say this because I know there's been a lot of emails and news stories and others, Mr. Chair, Ms. Todd-Malmlov, on why, and I've had some personal conversations. This isn't about, in my estimation, you're being malicious. This isn't necessarily even about, I know that you've had a lot of work to do in a short amount of time to do it, but this does start to create the hole that we're trying to dig ourselves out of. The one thing, Mr. Chair, what I would hope that this process and the exchange in the Affordable Care Act and MNsure as a product of it would be to attack this. And for whatever reason, and I didn't mean to be overly flip, but I do think we have a systemic problem in the way that we look at the grants, Ms. Todd-Malmlov. I do think that without having a diverse staff, or without finding other ways in which to bring people in to take a look at those grants, I think we've missed a huge opportunity. I know that I have personally, Mr. Chair, Senator Lori and others have known that I have met with you guys. I've conducted roundtable discussions to ensure that we wouldn't get to this point, that we would not to say that this is who you should give the grant, but just to introduce you to this community, to say, here are people who are doing this work. Some of them will I'll let them speak for themselves because they're here to testify, but to introduce you to them so that we can ask those questions if you're not familiar, because often, Mr. Chair, what I hear is that we didn't know, or they didn't have the capacity, or we wish we would have. And in addition to that, the conversations we've had, Ms. Todd-Malmlov and others on your staff, is the grants were supposed to be for even those agencies and organizations that didn't have the capacity that others had. To Representative Lawler's point, that if the grammar wasn't right, and I don't mean to patronize anybody, because I think there's very smart people who put in applications, or if they didn't have this long track record of getting grants from the state, that we would give them the infrastructure to do it. A lot of these folks are going to, even if they become navigators, they have to go out and get their own equipment and have their own infrastructure to get reimbursed. If they don't have those resources, then they're not going to be able to do a good job. And Mr. Chair, I'm reminded of just this week as we were talking about this, I got a call from a guy who acts as my handyman. And I had 6, 7 jobs. I'm not a handy person whatsoever. I'm sure you guys probably figured that out. And so I asked him where he'd been, and he had said that he had gotten sick and that he had 2 asthma attacks, and he was in the hospital. And I asked him, well, what's going on? Why is it not controlled? Well, he doesn't have the money to buy the inhalers because he doesn't have insurance, and they're pretty expensive if you don't get it subsidized. So we have a situation, person of color, who many of these folks know, could not make any money because they were sick, did not have an insurance, so I'm sure that they showed up at one of our local hospitals and didn't have the ability to pay. The system that we have today is incredibly complex to get through, and I know we're trying to fix that. And the very kind of folks that are out there willing, ready, and able to do that work, we missed them. We overlooked them. I don't know if we did it because of our process. I don't know if we did it because we didn't have the competency to understand what these communities look like and who are the trusted leaders, but we missed them. And the reason why I'm making this speech and the reason why I'm saying this, because we have had some of these conversations with various folks, is that if we don't change the way that we do things, if we're just doing it for expediency, or if you're saying, yeah, that doggone senator, he's on my butt again, or whatever the case may be, but if we don't do it the right way, then frankly, and I had this conversation with the chair of the board today, then we're going to do the same thing over and over again. Because we've done the same thing over and over again, which is why we have a health disparity today. We know in our own documents, just even outside of people of color, there's a great amount of people who are eligible for programs, but just don't take advantage of them because they don't know how to get through the door on these issues. So I guess all this, Mr. Chair, Ms. Malin, I have a question, and even Mr. Beutner, what are you going to do different to ensure that you don't make the colossal mistake of not getting these dollars to the communities that actually need them?
Todd-Malmlov.
So, Mr. Chair and Senator Hayden, first off, I just want to say that our intention with these grants was to reach every part of the state and all populations within the state. And I know we haven't had a chance to kind of talk through in detail on the slides, but just to give you a sense of the evaluation that went through, there's a slide, what page is that? On page 25, that kind of highlights the geographic distribution as well as the distribution of grants by populations of color and new immigrants. So we can't provide detail on specific applications, but did want to provide as much summary information as we could about the grant recipients, and did want to highlight, the focus that we did place on the grantees themselves and going to populations of color and new immigrants and trying to make sure we had as much geographic breadth and depth as possible. Just to reiterate, I think one of the things our board chair had mentioned earlier is that it is $4 million, and we got a multitude of requests, and we're not going to be able to fund all $4 million. There were numerous great grant applications that came through, and also great coalitions that came through that have a host of organizations included within those coalitions. And so our intention was definitely to cover every part of the state. And it was no intention to exclude any particular group at all that is there. We also have, given the wealth and apparent need for this funding across the state, as soon as that was coming in, we started to look to see if there were ways that we could bring in some additional funds to do that, and do intend to do that as much as we possibly can. And if there is in some way we haven't reached the right organizations, we want to make sure that we continue that dialogue so that the communities that really need these funds are getting them.
So, Mr. Chair, just to follow up, I appreciate the slide on page 25, but here's the problem. I can say, and I can write down and say that I really, really understand the Laotian community. I really understand. In my coalition, I'm going to find some folks, and I'm going to go to the Laotian community, and I'm going to pick the Hmong American Partnership to do so. Well, it doesn't work. It's happened before. They're two different cultures, right? So the question is, how would you know that wasn't going to work if you don't? And that's why I asked the question before. How many African or African Americans were looking at the grant applications? The inability for us and frankly for you and in your group to not say, yeah, we blew it. We didn't do the right thing. You know what? There's all kind of people sitting in this room who represent historic organizations in the African American community and really, really sound and have been dealing with this issue in the new immigrant community. And Ms. Todd-Malmlov, I appreciate you, the work that you've done. I appreciate this slide, but you blew it. You just flat out didn't get it right. And I'll say it over and over again until we admit that. And then what I want to hear, if not today, because maybe today's not today, but tomorrow might be a better day. That kind of dovetails to another question of how do people interact with your board to help you do that. But how are we not going to make this same mistake? And if you continue to tell me that you've done it right when you have not, when we all know that you haven't done it right, when I look here and say that there's 6 groups that said they serve African Americans, but that just because they say it doesn't mean they do it well, and maybe they've been doing it for a long time, Representative Lawfer, and the performance isn't there. So we end up with the same product. I'm not doing this because it's personal. I'm not doing it because I want to embarrass anybody. I'm doing it because I really, really care for that handyman who couldn't come to my house because he didn't know how to get health insurance. I'm really doing it for that person who has out-of-control diabetes in the church that I see and can't get the equipment that they need in order to get diagnosed and get what they need. I'm saying this for those folks. I'm saying this for that new immigrant in my community who is trying to figure out what is going on with them, and they can't interact enough, and they don't know enough people who can interact with the healthcare system to get the healthcare that they need, so they suffer over and over and over again. I hear it all the time. That is why we have a health disparity. And Ms. Todd-Malmlov and Mr. Beutner and others that are here, until you figure that out, we are going to have a problem and not be successful. And you're going to hear from me each and every time. So we have to do better. This geographic, all of that kind of stuff, that doesn't mean a hill of beans. If we are not figuring out who in those communities are the trusted leader and voices so that we can go out and tell them about this web portal. We could tell them about all this work we've done at extending Medicaid. We can tell them how to access that. It doesn't mean anything. We've accomplished the task. We've checked the box, but we still got a problem. And frankly, I am tired of coming here year after year after year with the same problem. I just said this to Commissioner Jetson 2 weeks ago or a week and a half ago. She showed me a very new tool that we're tracking it. It's a fancy, fancy tool. It's like those new Tesla cars, Mr. Chair. But if you're only going 20 miles an hour, you might as well have a Volkswagen. We are not doing what we're supposed to do. So I just need us to really kind of take this seriously, don't be defensive, and then come back with a real plan that says that we're going to get these dollars, these resources, this strategy. I don't care if we lower the Blue Ox grant. I don't care if we take the regional folks and give them and contract it out. I don't care if we look under the mattress and find more money. We have to figure this out. Otherwise, we're going to be in the same position, but we'll all feel good because we checked the box.
Thank you, Senator.
Thank you, Mr. Chair.
And to Senator Hayden's credit, he didn't wait to share these thoughts for this board meeting. He's been sharing them ongoing. Representative Loeffler has. I acknowledge Representative Mullery is here, and Representative Russo are here to share their concerns. Appreciate their joining us as well.
If I could, too, I hate
Senator Laurie
to follow my eloquent colleague, Senator Hayden, on this issue, but, honestly, it's tough not to be tone deaf as a, middle-class white guy living in rural Minnesota. And I'm not integrally connected with these communities, but my colleagues are, and serve them every day. And I've been literally inundated with deep concern about whether this is going to succeed over the outreach and effort that's been put forth with these trusted community partners that are well known and established within these communities. And so I just need to say that I really personally take these constructive criticisms very, very seriously, and hope that you do as well, and that we really get behind this, because the key point is this isn't the first time we've been through health reform efforts, outreach efforts, and we keep missing the boat. In fact, our health disparities continue to grow. And Minnesota, as a society, as a culture, we've not been able to get our arms around this in the past. And I'm very, very sensitive to the criticism and the fear that we may be making the same mistakes that we've made consistently. And I need to look to our friends and colleagues that are really tied to these communities and listen carefully and respond appropriately.
and Representative Mack, thank you for your patience. I know that you've been on the list for a while. And then unless folks really have something burning, we've got a number of people that have been sitting here with us for a couple hours who have some comments that they'd like to share, and I'd like to hear them before members have to leave. And I know that there was at least one or two members that had to leave at about 6, so we were concerned about making sure that we got to the public commentary. That's Representative Mack.
Thank you, Mr. Chair. And, maybe now won't be the time because I'm one of the ones that will have to get going and I want to hear public testimony. But I just wanted to, one thing we didn't touch on today was IT readiness. issues, and so maybe I'll just send an email with questions, and if that's available for the commission. But I guess I'm just curious on an update in terms of, if there's testing being done in terms of the ability of MNsure to communicate with the plans and the counties, and testing done in terms of how that all interacts and flow of information. Some concerns have come to me. I don't know which ones are valid and which ones are not. So I know we don't have the time and I know it's a big question with probably a lot of follow-up questions. So I can send that. I just wanted to say that, maybe an update on that, or even via email from you guys, letting us know we haven't hit the mark on this, but we have on this. October 1st has been the date, and I've assumed all along that means this thing is up and rolling. It's interacting with all the players it needs to fully be running. I'm not sure that is the case, and if it is, I'm excited to hear it. But I guess I was just curious, and the one piece of that is if this will work on all web browsers. That was a question that came to me from some folks in my district. Or will it only be compatible on a couple web browsers, in which case I think that will be important to educate the public on. So IT readiness, can email. I don't know the best way to handle that, Mr. Chair.
If you'd be so kind, Representative Mack, is to share send them to Ms. Todd-Malmlov, but with copies to the members of the commission, and then if you could respond similarly. All right. Thank you all very much. That brings us to the public comments. And again, folks, thank you for your patience. I've got a few people on the list. First up was Mitchell Davis, Jr. Mr. Davis. Welcome.
Thank you.
And if you just identify yourself for the record and then proceed. And then next up after him is Mr. Rhodes. From Minneapolis.
And there's two of us. My boss also is here as well.
All right. Welcome. Thank you for joining us, gentlemen.
My name is, Mr. Chair, my name is Scott Gray. I'm the President and Chief Executive Officer of the Minneapolis Urban League, and I have with me to my left Mr. Mitchell Davis, Jr., who handles our health and wellness programs at the Urban League. And I don't want to take up a whole lot of time because I think Senator Hayton really nailed it. And, the Minneapolis Urban League wants to see MNsure be successful. Let's just make sure that that's clear in the room. We appreciate what our governor is trying to do. We know that we're one of the first pilots to be rolled out, but we have to do everything right here. And we are in this full boat because we want to see folks get the type of health care services that they need in our community. But an organization that has been around 87 years, that has done social, civil, and economic rights and been an advocate in all those areas and provided solutions in this community should not be turned back in a process like this. Mitchell has been part of a number of committees helping roll this out from the onset, almost going back a year. And again, an organization with the roots of the Urban League, 87 years of being in the community. We have a staff of about 50 employees at our organization. We have a north side location, and we have a south side location in Senator Hayton's district. And so we think we have the capacity to do the work. I guess when the proposals, when the responses came back, we were made known that we weren't one of the recipients. And I just want to quickly say that that we do an event every year called Family Day, and I've been in this community for 4 years, and I didn't really know the relevance of Family Day until I started to sit in the seat. And about 3,000 folks come through Family Day a year, and it's done right in front of the Urban League. It also has a parade component to it. And one year I thought maybe we might want to cancel this or roll back a little bit because we don't quite have the resources. And when I put that message out there, I must have gotten about 1,000 emails saying, you don't want to cancel Family Day. And I followed that order because Family Day is the only activity on the north side of Minneapolis right now that I know of. And of course I'm a little biased here. But there are folks that are homeowners in that community or residents in that community where we roll down Golden Valley all the way through the community, and there are folks sitting out in lawn chairs thanking the Urban League for doing what they're doing. And it leads into a community resource fair that folks are with us from 12 to 9 all day. And 3,000 folks come through there a day. And so when you talk about specific things that organizations like the Urban League do that others might not do, something like Family Day is that. We also touch about 15,000 folks through direct programming a year. And so I think we are a connector. As a matter of fact, one of the organizations that we're happy to see win this opportunity for MNsure partners with us in our building. And their program happens to be the number one, the access to their program is the number one point for African Americans and other people in North Minneapolis, and it has been for the last 3 years. And so we love to take folks to the dance, but we want to be in the dance. And as Senator Hayden was saying, that if we're going to drive a Volkswagen, we can't drive a Volkswagen. The gaps are too wide here. And so we are asking for really two things. One is that we be made whole as legacy organizations, not just the Urban League, but there are a number of other partners that will be testifying here today. We want to see them made whole because we think they have specific skill sets to get to the communities that we need to. But I also think that we should be talking about a community benefits agreement. And what I mean by that is that there's going to be a lot of dollars that flow through this organization over the next 5 years. And we should be measuring not just what we will receive in grants, but what we should be measuring is the diversity. And I just happened to go to the MNsure website before I came here, and I looked at the top brass there, and I didn't see anybody of color. Unless my screen has gone down or what have you, it doesn't appear that there's any color there right now. And so I think that there's a great opportunity to diversify the ranks, and that is what happens from a community-based agreement. I think there's an opportunity to provide procurement opportunities for small and minority-owned businesses. And, this becomes an opportunity to grow capacity in our community in other ways other than showing up at the healthcare provider, which we know is important. But we want to build capacity in our communities so that we can make sure that folks are getting the best all-around services that they need. Because the healthcare gap is wide, but so is the employment gap. And typically when we see someone, we are dealing with a number of gaps, not just one. So thank you for your time today, and I hope that we can continue to work together as partners. But I think we have to be really intentional in that effort as we move forward.
Thank you, President Gray. Mr. Davis?
Mitchell Davis, Minneapolis Urban League. One of the Family Day was a powerful example that Mr. Gray gave. One of the key things that we also look at within our whole cafeteria of services, that's health and wellness, college readiness, is education, is workforce solutions, and is also wealth. And so we try to move a participant, a person, all the way through those avenues. All of us have gone through that to be where we are today. But if you don't have health, you can't go to school. If you don't have health, you really can't show up for work. And if you don't have health, good health, then certainly you're not going to have anything left when you really need it because you haven't had any time to put anything back in. Over those 15 to 20,000 individuals that come through our doors every year, we believe that not only will that high tech, because when you see MNsure, you see it on the website, it's certainly high tech, but we got to have high touch too, because there are so many individuals that aren't going to necessarily go to all of that media and digital at that first glance, but they're going to come because they know individuals. They're going to say, what do I do next? And that's what we're good at. We're able to carry them all the way through. So not only we're catalysts, not only we're an advocate, not only we're a provider and a builder-upper of people, but we also want to make sure and that we're in the game all the way. We started having health forums at the Urban League a year and a half ago. And that was through not only the Centers of Medicare and Medicaid, not only the Department of Commerce come, not only did MNsure come, not only did the Department of Health come, but we had individuals that we want to know what we need to do. We want to be a partner with this long term.
Thank you, Mr. Davis. Thank you, President Gray.
Chair and members of the committee.
Thank you.
And just in the order in which I've got him here, I've got Mr. Rhodes, Pete Rhodes, if he wants to testify. And I know some folks probably had to leave as the day went on. Is it Fortune Willie? Welcome. I did the best I could. Thank you for your patience.
No problem. Mr. Chair, members of community, my name is Fortune Willie. I'm Somali American, and I'm the executive director of Isuron. But I'm here today representing a coalition of Somali community members. Some of our members are masjids like mosques, Nurul Iman, which has over 10,000 members, women and older people, both men and women, and also Dar al-Hijra Mosque, which is also one of the largest civic engagement and faith-based organizations, and also disabled immigrants, Somalis, Ethiopians, and Oromos, like combined East Africans, and also some Americans who have been here. And then on our organization, which is the lead, which is one of the largest Somali women-led organizations in Minnesota. I think my brothers who have been here, you can tell they're from America and from Minnesota. They're very nice and not being upfront. But I want to say before I start what I wanted to say is that I want to become a devil's advocate and give a MNsure group a break. There was a saying today as I was sitting and writing what I was supposed to say, that the apple does not fall far from the tree. MNsure group don't have actually role models. They're just following the pattern of the blueprint or institutional racism that are ingrained in our state. I say this because professionally I'm a public health professional. I'm a health educator. But I'm also a project manager as an undergraduate, so everything I do is through planning and purposefully done what we do. And I think the most of my disappointment is coming from because we thought MNsure was a way of exit strategy for our community. We're immigrants, even though our African Americans and us have the same health outcomes. We as a community, we also have other challenges, which is the language barrier and the culture and the religion and the social connectiveness that we moved away and we came here. So I think that is our disappointment. We were thinking that MNsure would be an opportunity to system change and fairness. And since they don't have a good role models for our big institutions, they just have done what they know best, fund who they know more, and who they got, just feel safe. So my purpose here today, I really want to take my few minutes here to just talk about objectively as a project manager, how I see the MNsure and where the failure I see that it's coming from. And the first one is that I thought the project was very rushed and it lacks planning, because when you have a project that is real planned, you look at all the processes where it is, including the stakeholders, which some of them may be you, but also I'm looking at the point of view of a community that are a brand new community in Minnesota, could be the other stakeholders, our other friends who have been here before us. And risk assessment, that what we're doing, is it going to work? What kind of risk is this project going to do? And then what that happens, that it designs proactively what's going to come up front, which is, if this has been done properly, I wouldn't be sitting here, because those questions that everyone is raising today would have been answered and proactively addressed. And the other thing is, if you don't plan appropriately, you wouldn't actually have appropriately allocate the resources that is required to implement and design the project, which I'm going to get into, because we talked, there was a $20 million requested, and then you have $4 million to give. You can just see that, what's going on here. So two of the biggest issues that I have with this project, aside the institutional racism and whatever is going on, is the lack of the communication. We've listened to, because we were so excited about the MNsure, and we thought, oh my God, it's going to address culturally appropriate, it's going to address other alternative medicines that our community used, because we came from where preventative health care was not available. So even though my friends and supporters who are here, they all have chronic illnesses. My fight as a health educator is to prevent them having a leg amputated or having a stroke and having them to the hospital as soon as possible. Just do the regular checkup. Where we came from is a curative. It's not the preventative idea is not there. And I thought this was a huge opportunity for as a community and as an organization to use these dollars to build our capacity and implement and support our community. And so when we looked at it and said, what kind of other agencies or other states that have immigrants that are African Americans, what have they done better? What kind of a lesson can we learn as an immigrant community? So we've listened, a Massachusetts conference, the teleconference that they made, to talk about lesson learned about the way they implemented their project for the Affordable Care Action. And specifically, I was very interested in seeing how they outreached and what they have done for the minorities, such as African Americans, but also Somalis and Hispanics that don't speak English as a first language. One of the key factors, they said, of a communication that was very successful was how they approached. They said the first line was minority-led organizations and institutions such as churches that African Americans or immigrants use. They were frontline. They were working hand in hand, meaning that they had all the resources they had and they partnered, which means the original planning of the project, they were centered, they were partners. It was not like the project design was done and then they're brought up like a cut and paste system that you're using. So they said they were at the get-go, they were partners. These organizations have been identified through the planning and they were at the front. And once the project was enrolled, there was a huge partnership and no one went left behind. So then I said, well, if that is the case, how come MNsure groups are suffering? And they're not looking back and saying, well, what can we learn from other states? This huge issue is one of the problems that I have with this, and I think this was a lost opportunity, but there was never been an opportunity to reach out to minorities. And I say this wholeheartedly because I'm a public health graduate. I've done a graduate school, and everything I've studied point out that our state has systematic issues, and it will never change unless system change happens. So the other thing is, how do you reach out to MNsure group? I've seen very generic emails, just generic emails, and has the logo on MNsure. How should I respond to that? We'll get back to you, see you. There is no name attached, there's nothing attached, there's just MNsure. We reply emails, for example, we ask, you said we're not going to give you we got rejected, fine. Give us our feedback so we can learn why we were rejected, why we did not select. That was almost 2 weeks ago. We haven't got anything. That is one of the issues that also exist. The other thing I want to talk about is if you plan a project appropriately, then you would know there are a lot of methods to use to appropriately allocate resources. How come we're talking about $4 million when the need of even my own community, I would ask more than $4 million because I am not only concerned, am I going to enroll people? It's not like a slaughterhouse where you just put people in. What I'm concerned also is, are they educated to use the resources appropriately? Are there outcomes? Are we reducing diabetes? Am I reducing mental health issues? Are we teaching them about reproductive health, reducing chronic diseases, child spacing? Am I doing all that? I just don't see them, my community and our projects, as just an object to address just the MNsure issue. I don't see that. So I believe that this was not part of the planning, and the $4 million was just, again, the same other institution uses, like, let's throw something to the minorities and let them fight over. So, final thing I want to say here, as a person of a professional, an immigrant person, I see myself someone that can say, this project, the MNsure, is on my end. I want it to be successful with all the reasons I said. But I do not feel, out of the 126,000 Somalis community in Minnesota, we do not feel we were ever welcome in the system, never. So what can we do from here? There is a huge opportunity. I still have a huge hope that somebody can change something. So what we need to do is not too late. This project needs to be revised. We need to be part of the planning. Planning had been delayed, and we're not part of it anymore. We want our own minority community planning. We want to see, once the plan is done, what risks are going to come up. Communication is very key. We don't read. Our community, 78% don't read and write. So magazines are out. We don't watch a lot of channels. We have ethnic media television that just comes once a week. How are you going to communicate? The best way to communicate our community are masjids. That's where we go. If you go to the masjids, you will see thousands of them there. Do the group know about masjids and how Somalis communicate? No, they don't, because there was no question about who these audiences are. There's millions of dollars that's been spent, but one concept, which is social marketing, that studies every community, has been used. If that had been used, we would be part of this deal. We will never be that way. So as far as Somali community concerns, we're a very active community. We're brand new, but we're really determined to work hard and make sure that next generation gets healthier and we get jobs and opportunities. I looked at this as an opportunity for employing our college graduates who are unemployed. They speak the language, very savvy, so you're not hiring a translator. You don't need to write a journal or interpret anything. We speak the language and we're well educated. You could have hired us to do that job, and we know where the community is. We want a plan, very, very sufficient plan, which then means we need resources. Resources that is not constrained, because if everyone is struggling to find resources for the community, African Americans and African communities that are screaming, if few dollars are shifted around and throw us few dollars, that is going to set us to fail. It's not going to help us because we're not planning it. What we need is every community, our community is going to plan and develop project that we know it's going to help our community, that is very direct, has risk management, communication management, change management, which is very, very critical. How do you take the insurance that our elders are using and all of a sudden you say, here, use this one and go away? The anxiety and the pressure that will create, it requires a change management plan to be in place. So I don't want to take a lot of time, and I'm just saying, on behalf of my community, we're going to put our own proposal in, which means we'll have all the components that make projects successful, outcome evaluated, not only outcome that how many people have we put through the program or registered, but an outcome that can be measured that reduces the still $4, but for us, we're concerned human capacity. We want to keep every Somali person to our state. Thank you.
Thank you. Yes, sir.
Yeah, I want to say thank you, all of you.
Sir, if you would if you'd be so kind as to just move into the microphone a little bit and then identify who you are.
My name is Abdi, and I'm a Somali community working outreach. I think everything you are opportunity to say, I agree. So I'm asking you, as the chair and a senator and president, we need attention. What we Fortune talking about, really we need all those she's talking about. So only we ask you more attention for that issue. Thank you.
Thank you, Abdi, and thank you, Ms. Welly.
No? Okay.
Next on the list, I have Alfred Babington Johnson. Mr. Johnson. And then finally, I've got Sarah Greenfeld and Rich Neumeister also on the list, if you'd be ready to testify as soon as Mr. Johnson is concluded. Welcome.
Thank you, Chair Lowry, Chair Adkins, members of the Legislative Oversight Committee on MNsure, my dear friend and champion of our community, Senator Hayden. My name is Alfred Babington Johnson, and in addition to being CEO of Stair Step Initiative, I'm also the facilitator of a group called His Works United, which is about 120 African American churches, mostly in the metropolitan area, but also spread throughout the state. I had the privilege of serving with you, Senator Lowry, and Representative Atkins, and with Representative Huntley on the Insurance Exchange Advisory Task Force. I'm here today with a certain measure of sadness and frustration because since this is now a third of the way through September, I had hoped, instead of being here to testify and seek access into the process, that we would be deeply immersed in trying to do outreach and enroll folk into the insurance exchange. But thank you for the opportunity to share some thoughts. I was an active participant in the civil rights movement that marked our country in the 50s and 60s. And as we sat in or picketed or gathered at mass meetings, all of our activities were punctuated with songs. Ain't gonna let nobody turn me round, or we shall overcome, or apropos to this hearing today, hold on, keep your eyes on the prize, hold on, hold on. Now that last set of lyrics bears review because the appropriate implementation of MNsure requires that the prize, the big picture vision of what the Affordable Care Act promises and what MNsure can accomplish must be held forward as a bright, shining goal, and the actions and strategies involved in birthing MNsure need to be consistent with the big picture prize, the goal of having better and more affordable health care for all Minnesotans, which includes the elimination of health disparities. One of my proudest moments, Chair Atkins, Chair Lowry, and to the now absent Representative Huntley, was in our time on the exchange, we came to a point where we unanimously concluded that one guiding principle would be that in designing the exchange, the task force would actively seek out and pursue opportunities to eliminate health disparities. As you will recall, that determination came after strenuous analysis leading to two conclusions. First, that despite the positive health outcomes that Minnesota is celebrated for, we also have some of the most glaring health disparities in the nation. Secondly, the health disparities do exacerbate the cost of health care for the entire society. So an appropriate moving forward for the Affordable Care Act, or MNsure, would be intentionally designed to also eliminate health disparities. Over the last week or so, the decisions MNsure has made in respect to the distribution of the $4 million for outreach and infrastructure has been made public. Now, despite the fact that African American people experience the greatest disparate health outcomes, and despite the fact that more than 17% of the uninsured, 51,000, are African Americans, no community organizations of the African American community were chosen to receive any resources to do outreach and enrollment. Despite the growing numbers of Somali and other more recent Africans coming to America and increasingly having difficult health outcomes, no community-based, nonprofit Somali or African organization received any resources. Despite the clarity that those with mental health concerns are the most likely to be uninsured and the hardest to reach for insurance, the mental health providers are missing. These glaring deficiencies should be addressed. But please, don't let us think of this as some political brush fire that will be put out by dousing it with a bucket or that it will extinguish itself. This is a much more critical issue. The concern is the thoughtfulness and the direction of MNsure towards the issue of engaging the uninsured. It is at that point that MNsure will be successful. It is at that point that the Affordable Care Act will start to meet its responsibilities. Thank you for your time.
Thank you, Mr. Johnson. We appreciate yours. I have Ms. Greenfeld and Mr. Neumeister. Is Ms. Greenfeld still here? Mr. Neumeister. Welcome.
Mr. Chairman, members of the committee, nice to meet with you. Real quick, just the last 20, 25 minutes. Again, I come from a historical perspective who's been here for decades and overseen other kinds of initiatives about make sure that folks, when there's contracts, gets out to communities of color and other kinds of things. And that always has been a constant issue. Hopefully, what you hear from the folks today and the discussion here, particularly with MNsure, things can happen straight what everybody wants. Now, in terms of the comments, one of the things that, in terms of Mr. Chairman, Senator Benson's question was, what about the security of the millions of folks, or about 1 million or so of data that's going to be of MNsure? Well, as Mr. Turpin indicated, he says, oh, we're getting a lot of positives. Issue is, has there been a sign-off? That's the issue. And that's one of the things. And Mr. Chairman, as everybody on this committee knows, you could have disagreed with MNsure. You could have said MNsure is the best thing since baked bread. But everybody agreed, no matter what politics, as you so eloquently said in the newspaper article, which was also as part of an editorial, that everybody politically agreed on transparency and issues of privacy. And so that's in the confines when those comments are meant. It should be looked at from that perspective, not a negative or thing like that. So on that point. And one of the other things that I've noticed, because of the conference that I went to, press conference last Friday, and starting to talk with some folks, there needs to be an easy understanding on the website of what MNsure is to the individual that's applying. Over the years, I've seen sometimes when people are given material, whether it be, and the same with printed or on the web, what is the reading level? And I'm going to make some points. I think it may not be understandable. And whether or not there was any testing of that, which there is some done with government documents that go out or on the website, try and get to make sure there's a ease of readable, understandable English or in other languages so that people can assert their statutory rights for what is law. Now, the other thing was that, as you know, recently there was a discussion about Dolly, where 4 people in Dolly are being investigated for getting a lot, the Department of Labor and Industry, getting a lot of Social Security numbers and things like that, and then people being used to probably defraud or ID or whatever. Number 2, we're all familiar with the DVS. Now, the issue is with the audits. It's the audits that will catch people, and whether or not the audits are reactive or proactive with MNsure, I am not too clear. And so one of the things, and as you know, the security breach bill that did not pass last year for all kinds of reasons, is a proactive kind of attitude to do those kinds of things. So there needs to be a proactive. So I think it's important to get an idea about that. Now about the marketing. As you know, there was a lot of hubbub in the news media about the application through a temporary classification to make a lot of marketing data not public. Well, I oppose that. The Minnesota Coalition of Government Information, which is made up of a lot of news people, public people, citizens, whatever, opposed that, and the commissioner opposed it. For me, it was the first time where I've ever seen, in historic terms, marketing kind of data is going to be non-public. And I think the Commissioner of Administration made the right decision. Now, as I have done some interaction with MNsure, I want to see how MNsure came up with this idea. And I've gotten some of the data practices or some information from those requests. But recently, through an email from their data practices person, I've been told that they have some attorney data, which under law is basically attorney-client data and is not necessarily considered government data. But, Mr. Chairman, as you know, as a good attorney, and some other folks know, the privilege rests with the client, which the client is the agency, which is in this case either the board or the executive director. And so I'm just encouraging that that information be released. The other aspect of that, and I've shared this with Mr. Turpin, as Mr. Chairman, as you know, I am not shy in sharing perspectives and views, but privacy is still a huge element with MNsure and talking with people in that regards. There needs to be a simple kind of idea on the website or in forms or something. Hey, this is what's going to happen to your data. Don't use the whole legal stuff of data practices and all that, which sometimes gets in the way of people understanding. Some agencies have been very good at telling people, hey, this is what we're going to do with your information, this is where it's going, and all that kind of thing. And as I suggested to Mr. Reich, frequently FAQ or something, I mean, there's a number of things you can do. The most important thing out of all these was the element when I went to Commissioner Rothman after the press conference last week, and I said, Commissioner, and I've known Mr. Rothman for decades when he was working here in the Senate at one time, and so I've always had a good rapport, and he knows about my interest of transparency. So I said, are all the underlying data of how you got to these rates going to be public? And I didn't get too much a clear answer, other than when I talked to the deputy guy who was here earlier and a couple other people. October 1st is some of the things of the information is going to be public. But Mr. Chairman and members of the committee, why this element is so important? Because historically, that law has been used for the minimal amount of rate things that the Department of Commerce has historically done. I mean, I've been involved on a number of issues, so I know that the Department of Commerce doesn't have what other states do, where they approve rates constantly all the time. But now, with putting the MNsure rate, which is coming every October 1st, under that old law, which was used for a minimum type of rate, needs to be reviewed, looked at, to make sure that there's more transparency on the data of how did people from, how did you get from A to Z? I want to look at the data, how you got there. Now, there's all kinds of issues related to that, but some states have been proactive, and they give a little bit more or whatever. And that's something, Mr. Chairman, that I believe that your committee may want to take a look at in the 5.5 months before session. And as like any committee that does oversight, I know you're going to come up with a bill to come up with some of those little things you got to do, this, a little bit of that. So, Mr. Chairman, in the few moments that I had, I wish to thank you very much. Secondly, you got to improve now. It's the law. Whether you agree with it or not, you still got to go forward and just improve on things that are important for all the ideals that have been expressed by many of the people that are elected and those of people of the public like myself and other folks that made comments to you. So, Mr. Chairman and all that, thank you very much for the few moments of your time.
Thank you, Mr. Meister. I don't have anyone else that's signed up. Is there anyone else that desires to be heard? Representative Loeffler.
Thank you, Mr. Chair. I just really want to thank all the witnesses who stayed extra late, and it's unfortunate that not everyone could. But I think, particularly on the outreach effort, the key to me was in the announcement that it was demonstration of existing relationships within the population served. And I think we fell apart on that one, and I hope we can learn and move forward. Because these organizations, I know, I've been to events where they have thousands of people. They clearly have the trust and the heart of their community as part of their fabric, and they really want us to address the disparities that they unfortunately experience. And I appreciate everyone being here.
Thank you, Representative Loeffler, and on behalf of all of us, thank you to members, staff, and everyone who joined us this afternoon. Our next meeting will be at the call of the chair. Senator Laurie will have the gavel at that time. We'll give you plenty of notice in terms of when that next meeting is going to be. And with that,
Mr.
Senator
Chair,
Nino?
do we know when that might be? Senator Laurie maybe would be better to answer.
I don't believe we've discussed it yet.
Well, Mr. Chair, before we adjourned the last meeting, I didn't push real hard, but I pushed for earlier than later, and we ended up going later. We now are at September 10th. This thing goes live October 1st. Before today, we've had one meeting, and today we heard serious, significant concerns. I think they're legitimate concerns about conflict of interest and compliance with the law, statute. Clearly, Senator Hayden's not here, but clearly he and other members had concerns about the grant-making process. I would like us to set a date, and I think we should be back here in a week. because the board is going to meet tomorrow. They're going to talk about the grant-making process. We should have the opportunity to come back and talk about that. I would like to have some additional conversations about conflicts of interest. I'm not particularly comfortable with an open-ended meeting where we come back in 6 weeks and everything is in place. I'm just not comfortable with that.
Thank you, Senator Nino. And we'll do is we'll solicit input from all the members. We've obviously, over the course of the day, lost several of our members to other obligations. But I'd suggest we'll seek input from members, and then Senator Laurie and I. I don't think you'll get an argument from us in terms of doing it sooner than later. What prompted today's date was that we knew that we were going to get the rates released on September 6th, and we figured that folks would probably want to see what those were. So we were kind of functioning off of when those dates would finally become public. Senator Benson.
So, Mr. Chair, will you commit that we will have at least one more meeting before the October 1st go-live date with sufficient time that the board could react to any concerns we might have?
I'd like to do that, but I'd really like to, obviously my counterpart will be carrying the gavel. I'd really like to solicit input from all members. I don't see this as being a heavy-handed chairpersonship situation, and with only 4 of us remaining in the room at this point, I'd kind of like to get the majority's input and find out what people's schedules are and that kind of thing. Senator Laurie?
Well, just as some initial thoughts, I think that we had some very pointed conversations today, which outlined many of the concerns that we have, and each of us has an election certificate as well and can follow up and expect timely responses from these folks that are working literally day and night. I'm not so sure that we will be able to accommodate a meeting before October 1st. We had the executive director, the chair of the board. I saw at least 2 other board members, their entire executive team here today. They've got like 20 days to get this thing up and running. And I think that it might be very best, if our goal is to make MNsure succeed, to give them this 24 days or whatever it is, I don't know, 21 days, to actually succeed and continue to press our issues with them together. Share your concerns with me. We'll talk with them and see if there is another date that works. I'm open to the idea of a meeting before October 1, but I certainly am not in a position to guarantee you one.
I would note, by the way, that we've now had twice as many meetings as the Stadium Oversight Commission. There's supposed to be a groundbreaking.
How's that working out for you?
That is the bar, Mr. Chair.
I'm with you, folks. It's hundreds of millions of dollars at stake, and we just had a meeting that was supposed to take place earlier today got canceled. Senator Rosen sent out a cancellation literally a few days ago. So it's getting to be a bit troubling. But with that, folks, and we will send out an email soliciting input from members about when they'd like to get back together.
Well,
Senator Dino?
Mr. Chair, before we have a motion to adjourn, if this body does not meet before October 1st, it's a complete abrogation of our responsibility. This is one of the largest transformational events in the history of the state of Minnesota. This changes health care for every person in the state. And we've had, I would argue, one meeting of any substance. And for the chairs to sit there.
That was this one.
This one, yes.
All right.
And for the chairs to sit there saying, well, I don't know if we'll meet again before we go live. Ms. Todd-Malmlov said, we don't have protocols in place yet for data security. And we're not going to ask that question again before they go live? Seriously? Seriously? We have major oversight concerns here, and we need to exercise our responsibility. And I hope that we can come back before they go live and get these question answered. And if we don't, it's an absolute failure of this oversight committee.
Thank you, Senator Nino. Thank you, members, and thank you to the folks that have joined us this afternoon. We really appreciate your time and the responses. We'll also look forward to the MNsure folks responding in writing to some of the inquiries that were made. With that, we stand adjourned.